Okay. Whoop, 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 whoop. All right, let's go ahead and get this party started. Wait, hold on. What's today? Wait. Wrong thing. Hold on. That wasn't it. Okay. This one. There we go. All right. Hello, guys. Hello. Happy Sunday. Welcome to Camp Assembly. This is your Camp Nursing School Assembly. This is our weekly get together, our group chat, our wind down, if you will, our weekly wind down. And I call it Camp Assembly. All right. As you guys know, if all you guys are here, hopefully it's because you are registered for Camp Assembly for Camp Nursing School. Okay. That's where we've been getting you guys prepared for nursing school as much as possible. Getting your mindset prepared and getting your brain prepared, I guess, as well. All right, we're going to get you mentally, physically, academically, all that. We're going to get you as prepared as possible for nursing school. And we are in week 3. Actually, today's the last day of week 3. Week 3, we did fundamentals and physical/health assessment. All right, we're going to do a little bit more of health assessment today. But that is that was our theme for week 3. Week 4 will be tomorrow through next Sunday, so the 22nd through the 28th. And the theme is going to be pharmacology and dosage calculations, aka medical math, aka vomit emoji, boo, tomato. Okay? Drug cards, yuck. But I'm so sorry. I'm going to get y'all right. I'm getting y'all right. It may be annoying, but it's better to do it with me because I make it fun than when you guys do it in school because it's going to be super boring and annoying. I'll just let you know this now. Okay, so did you guys finish your assignments from this week? At least let me know. Thank you so much. This is our Camp Nursing School shirt. I was giving it a whirl. Giving our Camp Nursing School shirt a whirl. It will be available for purchase. Hopefully they'll be up and running sometime this week, but I will definitely let you guys know. You guys obviously get first dibs and you get a special price. All right, usually shirts would be like $29.99. That's how that's our normal pricing for our t-shirts. But if everyone registered for a Camp Nursing School, you will get this wonderful t-shirt. You can get this for $24.99 or you will be able to get it for $24.99 versus $29.99. So I just want to make sure you guys know that. And let me go back to it. All right, so let's go ahead and bring up our newsletter. All right, I'm going to bring up our newsletter. That was sent out Tuesday. It was sent out a couple times. Honestly, every time I sent out an email, I made sure that I attached at least the link for you guys to get to the newsletter. I'm looking at your comments, sorry. Okay, you don't have your, people don't have their syllabus yet. Your stream is go. I don't know what that means. I don't know what that means, but yeah. Let's go to our newsletter. Sorry, I was distracted. Y'all know I'm ADHD, and my medicine is wearing out. Newsletter. Let's bring up. Come on. What are you doing? All right, let's bring up our newsletter. So once again, fundamentals of nursing and health assessment. So this week, I let you know, a lot of it was done on social media just to, like I said, dose you guys with that information, repeatedly expose that information to you guys, even while you're doing something at your leisure, just casually scrolling on Instagram or TikTok, then boom, you see a fly, fun and entertaining video in which you also learn something new. So I want to make sure you guys were getting information both in your email, over our push app. If you downloaded the app, if you've not, what are you doing? Okay, what are you doing? Download the NurseSam app. It's free. It's how you play your your NCLEX Jeopardy, your Tease Tuesdays. You can also purchase your study kits as well, and you'll be able to purchase this shirt if you download the app as well. You can download it there. Not download it. You can purchase it there as well. But yes, we went over our need to know topics. Okay, if you guys do not have your nursing school supplies, your camp nursing school supplies, so basically your first semester study kit or your ultimate nursing school bundle. And I recommend the actual bundle because there are several different kits within, well, I guess our whole library that we referred to. So last week / this past one that just went by, we referred to our fundamentals kit. That's the Rugrats one. We referred to the IV therapy kit. That's the Beyonce Ivy Park one. We referred to the health assessment kit. That is the Wakanda / Black Panther tribute to Chadwick Boseman. That one. We also did some things in the pharmacology / NCLEX study kit, particularly like ABGs, arterial blood gases, and we'll go a little bit more into that next week during week 4 of pharmacology and dosage calc. But I just wanted to expose that to you guys because it went along with lab values, and that's one of the important things that you should definitely know for nursing school, in your first semester of nursing school. Okay, so a lot of people ask what to review, and that's basically what we went over. Not went over, but that's basically the theme of this whole week. Okay, fluids, electrolytes, and lab values, and everything that I'm saying can be found either in the first semester bundle, which is this one, or the ultimate nursing school bundle, which is the 400-page one that includes the first semester in addition to the second and the third. Okay, so fluid and electrolytes, lab values, diet and nutrition, that's like the Uber Eats inspired one. IV therapy, I just said that one, the Beyonce one. And we will be doing nursing skills and kind of giving you guys a scoop on like good medical sim lab, nursing sim lab apps where you can practice that. And then also today, physical / health assessment. Our giveaway winners, we're also going to go and announce our giveaway winners. I already picked them. I already have their names. So in just a few, I'll be announcing and putting that up on the screen, the giveaway winners of, it's 4 in total. But 3 people won the Saunders NCLEX PN book, and that's, well, PN or RN, depending on whatever program you're going to. I have both. So this is the NCLEX PN one. And this is the NCLEX RN one. RN one. And both of those have that online resource access that I was telling you guys before. I think I was saying that in NCLEX Jeopardy. The online resource center, top notch. Will forever love Saunders. Once again, not sponsored, just putting y'all on game. Okay, hold on. Let me go and stop and go through your comments just in case I missed anything. I don't think so. Wait. Thank you. I love the bundle. Also, bundle on point. Ew. Good. My head to toe assessment is in 1 more week. Woo! Well, that's why you are here, girl. All right, so let's go ahead and get into it. And let me actually pull it up in my bundle. I printed my bundle. Let me say this one more time. But our bundles, are digital. You can print it out if you want to. It is optional, but it is digital in nature. Okay. If you would like to print it out, you can either print it out at school, you can print it out at your house, or you can print it professionally. I printed mine professionally and in color. Okay, and it had it spiral bound. And I got mine printed at printme1.com. Once again, not sponsored, but just putting y'all on, because Office Depot tried to charge me $200, and Print Me One charged me like $85. So I totally went with Print Me One, and that was the quality, and it was amazing. It was $85 to professionally print in color, spiral bound, in 400 pages. So all that for $85. Okay. There will be, well, as far as recap, there's no video recap available, not just yet, but we give you guys like a recap email, and yeah, it's really a recap email. Yeah, just a recap of everything that we did last week, in addition to links to the last week's like homework, just in case you want to catch up and do those activities as well. Okay, Print Me One, that one is the number one. Okay, so for everyone that purchased the bundle or any of the bundles, you will receive a email letting you know of this, site, printme1.com. I'm not going to gatekeep that. But if you print one of my bundles and you choose to print it off, did I say print? If you purchase one of my bundles and choose to print it, I give you guys a 10%, an additional 10% off discount code. So you can just save a little bit more coin. Okay. But yeah, let me look at to see what y'all saying. Yep, that's who I use. That's how I use personally. That's how I use, or that's how I use personally, and that's what I recommend you guys use. You can if you want. You don't have to. It's just what I recommend. It's been the most cost-effective choice that I've seen with the best quality. So I'm just telling you guys what I personally use. And I'm very particular. I'm an artist. I'm very particular about my ish. So I'm a visual person. It needs to look good. So this is amazing quality. And I just wanted to make sure I put y'all on, just in case y'all have anything else y'all want to print, or if you just want to print this. Okay. All right. So who started their semester already? And if you haven't started, when do you start? See, Moni May says Office Depot is $250 plus. Yeah, they tripping. All right, so who, yes, like I said, who started nursing school or started their nursing program already, and or who's about to start, like who hasn't started yet but they're about to start. January, September. Kelsey started in May. Awesome. So those that started already, or at least started this semester, or even last semester, I'm assuming you took fundamentals already or taking it now, correct? Yes or no? Ooh, Miss KLW starts tomorrow. Moni starts September 6th. Ooh, Lord. You start Saturday, Diamond. Saturday class? Dang. You guys are starting next year. Snaps to you guys for, even though y'all starting next year, y'all already getting started as far as your prep. Listen, that's honestly the best thing that you can possibly do. Okay? Get started early so that it's not so much of a shell shock when you actually get into nursing school and attempt to adapt to that fast-paced environment. Okay? Demo fundamentals, I'm in pharmacology. Cover Girl, you're going to love this next week. Okay, so let's go ahead and let me go to my results. Did everybody take their fundamentals pre-quiz? This was our first camp nursing school. This was our first, I guess, like round of camp nursing school. I came up with that idea, honestly, while I was watching like Parent Trap or something like that. Y'all know I'd be inspired by a bunch of random stuff. But yes, this is my first time doing camp nursing school, and so far, I love it. It's giving do it again. It's giving do it again. Okay, if y'all think I should do it again, with different topics, like move on from fundamentals, blah, 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 and move on to like maybe like, second semester classes, move on to like certain chapters in or certain body systems in Patho or MedSurg. What's something else? What's another class? Mental health, that stuff. Let me know if y'all want me to do this again. Ooh, yes, yes, yes. Awesome. Cool. Okay, cool. OB and Peds. Okay, awesome. Oh, that made me feel good. Okay, now I'm gonna brainstorm and try to figure out what else to do for you guys. Get y'all even more lit prizes, because like I said, I want y'all to be as prepared as possible without having it to either come out your pocket, worry about, the stress of how to afford this resource. I'm gonna take that stress off y'all hands. Okay, y'all got enough to deal with trying to learn this, that. So I want to, like I said, make sure you guys are as prepared as possible in any way that I possibly can. Okay, so let's go ahead and get into our fundamentals pre-quiz. Did anybody have any questions on the pre-quiz? Did you feel like you had a good grasp? Did you feel like you had a good understanding of fundamentals after you saw the results of it? Let me see if I can see like a summary result. Let me see what y'all saying. So many people don't get past fundamentals, believe it or not. No, I believe it. And then you like go on, and when you're in like classes like med-surg or maternity, and you look back and be like, damn, I was really struggling in fundamentals, and now looking back, I'm so advanced and such a genius. That's what y'all gonna be saying, child. How did I get that stuff like wrong? Why was I struggling with that? It's because you start to progress and evolve, and you start to really understand how questions are going to be asked, how the exams are going to be shaped, and then like you start to adapt, and then practice makes progress. So as long as you're doing those things, you'll be fine. All right, so let's go to our thing. Okay, so I'm looking at the average of people, like the average score for everyone that took it. And our average is about 64.7%. So I'm going to round that up to 65%, like 65 out of 100, so 65%. So that would be 65 is a D. 65 is a D. But once again, pre-quiz, the goal of that is for you to, if there was a question, or if there was an exam for you to get questions wrong on, it would be the pre-quiz, the pre-test, whatever you want to call it. It will be that one, because A, it's going to let you know what areas you're weak in, so that you can go ahead and target your study plan or study learning towards whatever topic you need more time with, so for better comprehension. And it's also, like I said, it's going to give you your study plan, so you know what to what to score, or study, I should say. So let me go ahead and see. So what I wanted you guys to do, and that's why I gave you guys the option to send it to you or email it to yourself, so you can kind of see the responses and the rationale. Okay. Wait, hold on. Let me scroll back down. Since of the fact, excuse me. I was thinking too hard about the questions. Overthinking. I am a professional overthinker. Okay. If there was an overthinking Olympics, first place. Okay. It's a quiz on the app. I only just signed up, so I missed it. Even though you just signed up, it's still week 3. So in your sign up email, you will get, make sure you check your spam, xpixie21x. Make sure you check your spam, your email, or your promotions or updates, depending on what kind of email system you use. But make sure you check that for your week 3 newsletter / agenda. It's going to give you your schedule, and on that schedule, it's also going to show you your camp activities, just like here, and it's going to give you the links. So the fundamentals pre-quiz, that one's given to you. Well, like I said, all of them, all the links are given to you on it. It's a piece of paper or a PDF, 1-page PDF. Don't print it out. You need to click on the links. So when you open it, click on where it says like click here or submit here. Click on those hyperlinks and it will give you what you need. So that's where the quiz is. Maternity, peds, med-surg, mental health. I just joined today, wasn't aware of this. How do I enroll? What do I need to do to be a part of all that's going on? This should be on Zoom for the camp members. It's kind of confusing. No problem, xpixie. What are you confused about, One Lucky? Let me see if I can make it clear for you. Okay. Make sure you read all the emails. Like all of it. It's going to clear some things up for you and explain everything. So if you go ahead and read through those emails that you get after registering, it should clear some things up. But just in case, I'm here in the open. You can ask me any type of questions and I'll see if I can clear some things up for you. All right. So while you guys are doing that, I'm going through the questions and kind of going through the answers. So for the first question was, the triage nurse has just returned to the desk. 4 messages to return. You know, which one should we return first? 88% of y'all got that one correct. That one was B. It was the one about the man that was complaining of heartburn that radiates to his jaw. That's the one that she should return first because that can indicate chest pain, which can be a precursor to a cardiac event. So that's going to be the priority. All right. That's going to be, you're going to hate the word priority by the time you're like in week 2 of fundamentals. I promise. So that one was good. Great job. The next question, about 52% of you guys got that one right. That one was about the restraints. It says, when using restraints for an agitated patient, which of the following statements should not influence the nurse's actions during this intervention? And the correct answer was C, the patient's voluntary / involuntary status. That was the correct answer. We're 7 weeks in. Someone said, yep, I'm there. That's funny. All right. That one's 50%. I'm going through 55%. Okay. So I got that one wrong. Do you want me to go through that one? It seems like that one was the one that really got everyone confused. So if you want me to go through that one real quick, we can do that. Or do you guys want me to jump into health assessment? Which one? Door number 1, which is go over this question, or door number 2, which is start health assessment? Which one do you want to do? Wait, yes to what? Door 1 or door 2? LaBelle Spirit. That tripped me, but I got it right. Woohoo! Good job. All right, everyone says go over door number 1. All right, so let's go to it. Wait, wrong question. This one. Okay, so it says, I read the question, right? When using restraints for an agitated patient, which of the following statements should not influence the nurse's actions during this interview? A, the restraint / seclusion policies set forth by the institution. B, the patient's competence. C, the patient's voluntary / involuntary status. Or D, the patient's nursing care plan. Those were the choices. The correct answer was C, the patient's voluntary/involuntary status. What did you guys say? I wonder if, can I see which one? I'll look into it in just a second. Let me scroll back up, make sure y'all see it. Okay. But yes, the answer is C, the patient's voluntary/involuntary status. All right, it asked us for which of the following statements should not influence the nurse's actions during this intervention. The intervention was using restraints for an agitated patient. The answer was C. So the patient's voluntary/involuntary status should not influence the nurse's actions during using restraints for an agitated patient. Y'all said, I think I chose D. D was the patient's nursing care plan. Wait, what? Yeah, D was the patient's nursing care plan. This is what the rationale says. It says the correct answer is C. The need for restraints is based on patient's behavioral status and condition, not the voluntary/involuntary status. So that's why the answer was C. All right. Y'all chose D. Let me see what y'all saying. I think I chose competence, which was B. Chose competence. I read it too quickly. Yeah. Whenever there's a question and it's like, which one should not? And it's like bold, all caps, underlined too, with a little like italics for a little razzle dazzle, child. Whenever I see words like that, I read it again. I read it a couple times because I know me and my brain, I'm going to read it too fast. My brain's going to try to answer it too quick. And I'm going to read something wrong. I'm going to miss this bold word. This very word that it has bold for some reason. we completely just skip that word over. It's okay. It happens to the best of us. We get too excited. We want this test to be over. I'm trying to read this question. But yeah, that's why you should always practice pacing yourself. Okay? With timed comprehensive mock exams. That's why on my mock study plan that I put in, that example for you guys, I put that in once a week. For every week or for every topic. I was telling you guys this last week. I always start with the pre-quiz and then end with a post-quiz. I hope that's a hint because we definitely started this week with a pre-quiz. And I hope you know that after this live, we're going to end it with a post-quiz. So be on the lookout for that. Absolutely. Okay. All right. So yes, that is... that's the answer for that one. Let me go ahead and go back. Oh, what did I do? No. Okay, great. So the question that was missed actually the most was the one where it says, you prepare to administer an injection of haloperidol decanoate. Sure. Or Halidol-D. Which nursing action is most appropriate? I gotta go to this. A, massage the injection site. B, give deep IM in large muscle. C, use a 2-inch 25 gauge needle. Or D, administer the med in divided doses. The correct answer was B, give deep IM in large muscle. A lot of people chose A, massage the injection site. But the answer was B, give deep IM or intramuscular in large muscle. Okay. Let me see what y'all saying. Can you go over the one where the answer was the I am? Oh, pretty girl, we were just doing that. All right. Great job, Haley. Great job, I am Abina. Ronim. E Flesh. Pretty green eyes. Great job. As I said, I chose A. Massaging the injection site. Let me go to the actual question for the rationale. Where are, oh, rude. Oh, rude. Huh. Wait for it. Okay, it's this one. Okay, yeah, here are options. Okay, rational says, correct, the answer is B, which is give deep IM in large muscle. All right, the medication, the Halidol, that is irritating to subcutaneous tissue. So it has to go deep IM because it's an irritating solution. Okay. For those that chose A, which was massage the injection site, that one says incorrect. The answer is, just repeat sentences. The answer is B because of what I just said of why it's the correct answer. But incorrect. You do not want to massage the injection site, especially because it's an irritating substance. So if you take this irritating, like imagine having a cut and then pouring alcohol on it, and then or pour like acid or something like that, something that's like burning on the inside, and then just taking it and rubbing it and spreading it even further and deeper. Just imagine that. So that's why you don't want to massage irritating injections. That shit gonna hurt. Okay. What's the next one? Let me go back. Okay, everyone chose A, aka in the bootay. Funny. Good eye, E Flesh. Thank you for pulling that out because I was just about to. Yes. Someone said there were 2 right answers. Absolutely. That is the blessing and the curse of nursing school, okay, and nursing school questions. It's not going to be like, oh, pick the right answer. All 3 of them are just so obviously wrong. You know, it's not going to be like that. It's going to be questions like this where you're going to have 2 correct answers or 2 questions or 2 answer choices that could possibly be the answer, but the question's asking for the most appropriate, okay? The most appropriate. And usually when it's anything priority, it's whatever's going to keep the client safe. That's the theme of NCLEX. That's the theme of your goals as a nurse. Keep that client safe, away from harm. So whatever the most appropriate option is usually the safest, or usually the one that's not gonna, well, that's synonyms, not gonna put that patient into harm or possibly hurt that patient in any way. Does that make sense? But yes, thank you, eFlash98. I thought it meant massaging prior to the injection. No, this said massage. No, usually when it says massage the injection site, even if you do massage it before the like actually giving them the shot and injecting it, you still don't want to do that because you just clean that area, and if you go back and massage it, you're that area is no longer clean. That area is no longer safe and sterile for you guys to put that injection in, because remember, that's an invasive, even though it's a small little boop, it's still an invasive procedure. So you still need to have sterile technique. Okay, so you don't want to clean off as much germs as possible and then reintroduce more germs just to massage it. So it wouldn't be that either. So don't massage before or after. Okay. Let me look and see what y'all saying. But yeah, so look at it like that. Sanitary, absolutely. Okay, was there another one y'all want me to go through? I don't know if there's any like real like medical reason for someone to massage an injection site prior to an injection. It's not going to do anything. So there's no benefit to it. You know, you're just giving your arm a massage. You're just going to or giving your booty a little squeeze, but it's not going to have any effects or bearing on the injection that's about to take place. But you know, if you want to use that as an excuse to get your booty rubbed, go. Especially if your doctor fine. Oh, absolutely. Can you massage the outer fourth, doctor? And then just boop, boop, boop. Okay. I'm done. All right. Anything else y'all want me to go over as far as this pre-quiz? Because y'all will be getting a post-quiz. Just want to let y'all know. You will be getting a post-quiz. Don't laugh at me, y'all. All right. Any more? Guess not. Okay, cool. Let's go ahead and you gotta spank the injection site afterwards. Oh, well, a blessing. So I'm totally just kidding. No, you're not. You are serious. That sounded like a story. Do we need a story time? Because I feel like it. All right. Let's go ahead and get into health assessment. Okay. Wait, what time is it? 6:10. It's about, yeah, let me get into it. All right. If you guys have your Ultimate Nursing School bundles or your first semester bundles, go ahead and, or if you were one of the ones that were lucky a long time ago, maybe you've been following me for a little minute and was able to catch this while it was a freebie, great for you. Go ahead and open it. But I need y'all to go ahead and take this out, the Health Assessment Nursing School cheat sheet. All right. It is the one that is like Wakanda / Black Panther themed. There you go right there. Boop. All right. So you have your title page. You're going to have your head to toe assessment. This is going to be the page we're going to be referring to and referencing. And then you actually have your physical exam technique. Okay, I posted a reel today and a TikTok about the 4 physical exam techniques and the order, the specific order that you need to go in for physical exams. And also more specifically, there's a different order for when it's an abdomen assessment. Okay, so that's what we're gonna go over. Make sure you guys, after live, of course, make sure you guys check out that post and save it. It is great information and it's cute. So let's go ahead and take that out. Wait, let me see what I was saying. I saw somebody ask a question. What bundle do you recommend prior to taking the entrance exam to prep for nursing school? I recommend the ATIT's bundle. That's going to help you for your entrance exam. All right, cool. Let's go ahead and get into our health assessment, or head to toe. Okay, head to toe. This is going to be one of your checkoffs, okay, for all my first semester students. Okay, you will be getting a check off during like sim lab, skills, not sim lab, but I guess skills lab. I don't know what y'all call it in y'all program or state. It will be like a skills lab check off. Okay, that's where you basically have like a mock patient, mock situation, basically a case study game. Basically, it's like a case study and or chart file, whatever, however you want to call it. They give you information, and what you have to do is actually go through a physical assessment. So whether or not that's the teacher or like a paid actor, your mama, your 3-year-old, whoever it is, you have to go through from top to bottom, from head to toe, the head to toe assessment. I test out next week and I'm so nervous. You got this, Pixie. You got this. I'm sorry. I'm trying to find this in my book. 1 second. Y'all heard that? He plays so much. Okay. Let's go. I'm glad y'all didn't hear that, so that's fine. All right, we are going to our health assessments. Sorry, I can't find it. Ah, wait. Nope, here we go. Okay, cool. So, take out your handy dandy health assessments. Go to the head to toe assessment. All right, so when you're thinking about head assessment, I don't know if y'all have ever, I hope so, because everyone here is like at least 18, I hope, or close to it. I'm hoping you've had at least one physical in your life. And when you went and you did the physical and your doctor or provider, whoever was going through, literally from here all the way down to your feet, checking out every area and doing all these weird different tests and testing out these things. Y'all remember that? That's a physical assessment or a physical exam. However, head to toe is basically that, but on steroids. It's a little bit more, it's a lot bit more detailed, because usually head to toe assessments are done on inpatient patients rather than, 12-year-old Timmy for his is here at the doctor's office outpatient for his baseball league. Like it's two different things. Inpatient is a little bit more specific because you have to literally account for everything that's on the patient coming in, so you can see whether or not they got worse, stayed the same, got better, got bed sores, like what's here now that wasn't here before. Okay, so that's the initial assessment. Okay. Yeah, that's the initial assessment. Okay. Now, delegation question and scope of practice question. Even though the scope of practice for LPN differs between states, and correct me if I'm wrong, please, but I do believe that across the states, though, at least a majority, if not all, that LPNs cannot initiate assessments. Not initiate. Do initial assessments. At least in the state of Georgia, I don't believe you can. Yeah, I think that. But if I'm wrong, let me know. If I'm misinformed, please let me know. But I do believe that. So, honestly, the difference between an initial assessment and the focused assessment, which is what usually is, that's honestly the follow-up. It's every assessment after the initial. It's the same assessment, but the RN has to be the one to go in and make that initial assessment, if that makes sense. But yeah, so just in case, someone asked me a question in my DM, so I just want to make sure y'all knew that. All right. So, head to toe assessment right here. You have 1, 2, 3, 4, 5, 6, 7, 8, 9. You have 9 different little boxes around. Oh, rest in peace, Chadwick. This is so sad. But yeah, you have 9 boxes around here. And they represent different systems and different categories of things that you should definitely, or that you're going to need to be reviewing or assessing. All right, we're going to start with vital signs. Okay, that's just going to be your basic, your number one. You got to see how are they doing currently? What are their signs of life? What are their signs of life? Once again, so we can get that basis. We need to get that foundation so we can know how we're doing based on every other vital sign that we get after this. We can compare. Okay, so vital signs. You want to get your blood pressure, your pulse, your temperature, your respiratory rate, and don't just cheat and put 18 or 16. Oxygen saturation, not saturation. And height and weight, especially height and weight for our first time clients, patients, whatever setting, facility, wherever you are. But yes, height and weight is definitely important, especially if it's like a kidney patient or a renal patient or like a cardiac patient. Super, super important. Okay, so there's going to be certain things that you say when you go in. When you go in, you're going to go in with like a clipboard. So that's why I gave you on that nursing school supply list. I told you guys that like there's a thicker one and a skinnier one, like a foldable one as far as like notebook, because you're going to be going in and out of rooms and you will be recording vital signs, recording different values, having it on hand for report or clinical or just whatever, just for reference. So you will need to have like a writing tool or just writing utensil, just period. So those clipboards are great for it. So usually you have a sheet with the different reviews of systems, so you kind of like follow along with it, but you have to know how to review those systems. All right, so you're gonna have a piece of paper, like like just like on template. If you like Google, like especially on Etsy, if you Google physical assessment or head to toe assessment sheets, it's going to give you like a blank. It's all these questions. Basically the same questions that you fill out when you go to the doctor for the first time and they tell you to come 30 minutes early because you got to fill out a whole Harry Potter book full of things that you honestly don't even remember. But yeah, basically that. You have to go and even though they fill that information out, you have to go and kind of like put that information together and like link it up and associate it and kind of like create a timeline and paint the picture and interview them in a sense. Okay, so nurse / interviewer / professional butt wiper / bad bitch. No, I'm just kidding. But yeah, that's the start of our head to toe assessment. You're also going to be tested on how you do the physical, the head to toe assessment. All right. So not only will we test on like whether or not you know the steps of the head to toe assessment, you'll be tested on your patient interactions when you're going to do the patient assessment. This is what I mean. So you can have all this, and this happened to me, that's why I know. You can have the steps down to a T in your mind. Well, I know what to do. You're going to get bam, boom, boom, boom. Answer the question right. That one. And then, you just go. This was during my sim lab, my simulation lab. And I had to do the head to toe assessment and like talk out loud what I was writing out loud because they were like grading me. So after I like answered everything and stuff like that, I was finished. I felt good. That was my first time doing a sim lab. So the only Sims I know is Sims 3 and Sims 4 with the little green little things on top. That's the only Sims I know. So when I was introduced to Sim Lab, I was confused. Super confused. What was I saying? Hysterectomy brain. Please remind me. What was I saying? Oh yeah, which will be graded on. So you can know all the content and all the different steps and say everything right, but get like 25% knocked off your grade because you didn't knock on the door when you came in and you didn't introduce yourself. Sorry, that was a very personal thing that happened, and it makes me mad to this day because I legit went from like 100 to like a 75 because I didn't knock 3 times, wait for the patient to say to come in, and then introduce myself, say who I am and why I'm here. I literally lost 25% over that. But I never did it again. I never missed it again. But yeah, you'll be graded on that as well. So it's best to get prepared, all right, and practice doing it. Okay, so in our next meeting, I want to try to do like a real mock exam, and it may not be live. It may actually be like a recorded video that I send to you guys, and I want you guys to like write up a specific thing. But Ronnie said, "Don't apologize. Share experiences so we can learn." That's true. That's why I'm doing all this, so y'all can learn from my mistakes and don't make the same mistakes that I did. So that's why I want to walk through this head-to-toe assessment so you know. All right, so with that being said, when you're doing a head-to-toe assessment, I think someone was just saying that like they definitely test you on that. Learn that getting my phlebotomy certification. Yeah, they test you on your patient care and your ability to pay attention to the client's safety. Okay, so first things first, you want to knock on the door. Okay, listen. Knock on the door, listen for them allowing you to come in, like whether or not they say come in, something. Do not go in until you get the patient's okay that you can enter that room, or you will instantly fail. I didn't instantly fail because I didn't make that mistake, but one of my classmates definitely failed out. Not failed out the program, but that specific assignment, yeah, they felt that. Because they were just like, hello, and like walked in like your parents usually do on you when you're a teenager. They definitely felt that because of that. So knock, wait for them to tell you can come in right when if it says what if no answer. It's like depends on your policy, but you usually do it a certain amount of times, like knock, hey, this is me, knock, whatever. And then after so many, if there isn't one, then you go in anyway, especially if it's in the hospital, because you want to make sure it's not a safety issue, make sure they're not like in the tub somewhere or like on the side of the bed. So you always want to give them the space and opportunity to have their space and privacy, but still, like I said, making sure that they're as safe as possible and maintaining that client safety. Does that make sense? We learned Kiwi. Knock. I was like, what's a Kiwi? Not what's a Kiwi, but I was like, damn, I do want a Kiwi. I was like, well, I'll keep saying Kiwi. Knock, identify yourself. I was just about to say, the next thing you do, honestly, after you knock and come in, while you're identifying yourself, you need to be walking over to the sink. Yeah, so just simultaneously, hey, we're going to do it like this. Hold on. This the door. This the door. Y'all don't see it. We're going to put it right here. This the door. Come in. I'm the patient. Come in. All right. And then you open it, and then you go into the door, into the room, and be like, Hey, Miss Johnson, and you're walking to the sink. Hey, Miss Johnson, I'm Nurse Sam, and I'm gonna be your nurse today. Wash, 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 wash. Can I get you? And then confirm their identity. Can I get you to tell me your name and date of birth? Wash, wash. You're doing all this simultaneously, so you don't really seem like a robot. It has to be like a natural, like, dance. Once again, you will be graded on not only the content, but your, like, not only the, how do I want to say this? Not only the material, okay, and the actual assessment itself, you won't only be judged on that, but you'll be graded on how well it meshes together, if that makes sense. Okay. Not the patient talking like that. She was 73. She been a smoker all her life. Look how it flows. You're right. The approach. Right. Absolutely. But yeah, you'll also be graded on that. So the things that you want to, like, get like a rhythm for and a flow, and kind of like we will always call it, like, we're rehearsing like a play, because it's almost like a scene. You have to memorize this, like, monologue, and that's honestly what it became. At least for me, you know, she was a theater major. She was a musical theater major, literally most of her life. So she's a thespian, all right, and she's familiar with the arts. Okay. So that was easy for me, child. So I just acted like I was in character, and I just said my little monologue and just went like that. That's how I honestly did it. That's how I did it, just because of the way I study and the way I am. But yeah, that's what I had to do to make sure I didn't miss a beat. Not the thespian. Absolutely the thespian. Troop 88050. Sorry. But yes. All right. So after, wait, what was that last I? Walk and I'm going back to Kiwi. Identify the patient. Yep, absolutely. Identify the patient. Okay, so after you do all that, you want to get your sheet and just honestly follow along the sheet. You want to get the vital signs. Okay, depending on usually in nursing school, they just have you do it manually so you can practice doing manual blood pressures. So you want to do your manual blood pressure. You want to record pulse and oxygen saturation. Those are usually recorded at the same time on the same device, using like the infrared little thing that goes either on your finger, usually on the finger, little red sensor, and that records your oxygen sats and your pulse. Respiration rate, that's recorded by you as the nurse. You're going to just record. You're not going to let them know that you're recording their respiratory rate, because then they start to get conscious of it, and then that affects their breathing. They start to like do it on purpose almost. And so it's not natural. So while you're like looking at your watch, getting the pulse, usually you do it at the same time that you take pulse. Because usually in addition to that recording the pulse, if it's electronic, you taking that pulse, you have to do it manually. All right. So when you're doing it, when you're recording the pulse here, you're looking at your watch for a full 60 seconds for a full minute. Okay. Usually, like when you get into the workforce and you're like running low on time, they're going to have you like do this for 15 seconds and times it by 4, or do this for 30 seconds and times it by 2, like different like little shortcuts. But for your actual head to toe, the initial, you want to do everything, like you want to get it as accurate as possible. So you want to do this for a full 60 minutes. And while you're doing this, after those 60 minutes have passed and after you've finished doing your pulse, you want to, like I said, quietly and secretly record their respiratory rate. Okay, so every time they breathe in and out, when you see their chest rise and fall, record that. Okay, like I said, you don't want to be obvious and let them know they're doing it, because they're gonna like mess their breathing up. It's weird. So that's how you get your respiratory rate. Then you want to get temperature. Okay, I'm not sure what the actual protocol is now for like the majority of hospitals. Maybe it varies, I'm not sure. But for your head to toe, especially in nursing school, they're going to make sure that you know how to get the most accurate temperature using different like avenues. Make sure you know how to get the temperature when it's recorded tympanic, which is in your ear, or temporal, which is forehead, oral, in your mouth, rectal, where the sun don't shine, axillary, underneath your armpit. So all those different like places. There's probably more. I'm probably missing it and I can't find my page. Wait, no, I found it. But yeah, those are the different ways that you can do. Oh, in your ear as well. Those are different ways where you can like record your temperature. But those different locations, the reading will be affected. So what you will usually have to do, depending on which location it is either like add a degree, subtract a degree to make it, as accurate as possible. So there's a location. What's the location? Let me see if y'all know. What's the most accurate location to get a body temperature? Thirsty, Jesus. Let me know right here in the comments. Let me know right here in the comments. Rectal. Why is my throat like that? Is it dry? Yes, rectal. That's going to be the most accurate temperature. All right. Another thing about the pulse, when it's a specific, not a head to toe assessment, but when it's a specific cardio exam, like a cardiovascular like assessment, you want to measure the apical pulse. So you want to auscultate. Okay. You want to use your stethoscope to listen to the apical pulse for, once again, a full 60 seconds. Okay. You also, presence of pain, that's also a vital sign. You would, depending on that patient's like mental status and orientation, you want to do one of the many pain scales, whether it's like the face or the numeric pain scale. You want to get a base reading for their pain. So you, once again, see if it's getting worse, staying the same, or getting better. Okay. You're also going to let's get back to the actual physical exam techniques. There's 4 techniques, and this is what my video was before. There's 4 techniques, and there's a certain way that or a certain sequence that you do these techniques when you're doing a physical exam. All right. You do an inspection, aka an observation. You're literally visually looking at or visually observing the client and everything about the client. All right. Not just, their physical skin, but, observe everything. If you are, definitely observe their skin. Look to see if you see any scars, any tattoos, any cuts, abrasions, moles. Look to see if you see, are they ashy? Are they well moisturized? Like, do they look disheveled? Look at their clothes. Is it dirty? Is it clean? Are they like well put together and well kept? Obviously look at the color of their skin. What's their race? Does the color of their skin match their race and how they're supposed to look? Honestly, make sure they're not blue and another color, or like they're not yellow, type situation. So you always want to look before touching. Always look before you cross the street, look before touching, inspect before everything, okay? So you're not going to touch with your hands or with instruments. You're just going to observe, okay? The next thing you do for a regular physical exam is you do palpation, okay? Palpation, that's when you palpate or you firmly press. That's what palpate means. Deeply pressing. All right. Now there's two types of ways that you can palpate something or palpate a body. Light palpation, that's going to identify any tender areas. So that's how you assess for, like, if you do someone's flank, you're assessing for kidney infection. Let's say there's like bladder tenderness. You do light palpation to assess for that flank tenderness. Okay. Same thing with if they have stomach pain and they have rebound tenderness, you would assess that with light palpation. Okay. Now with deep palpation, okay, it's also going to identify the tender areas, but you're going to light palpation is going to be with one hand, and deep palpation is with two hands. Okay, like think of a deep massage. You can't do a deep massage with one hand. No, I need both. I need the power of both. A deep, almost a massage, a deep palpation. Okay, so as far as your hand, that's obviously going to be your key instrument when you're palpating anything. Okay, so your fingertips, that's going to be important when you're for fine tacticals. That's what it says. Okay, so when you're observing or assessing the characteristics of fine things, such as like the skin texture, is it bumpy, is it smooth? That's what your fingertips are going to assess. You can pinch fingers for tissue consistency. The back of the hand, the dorsa of the hand. All right, that's how we check temperature. All right, remember when like you were sick or faking sick and your mom would come and check your temperature, or you go and check your kid's temperature? What do you use? What side of the hand do you use? Right, the back of the hand, the dorsa of the hand. Okay, it's for temperature checks. The palm. All right, this has the of our entire hand, this has the thickest layer of skin, because we do more of the day-to-day like wear and tear on our palms. We pick things up, we're writing things, we're throwing things. All right, so this is where our fingerprints are. So this is gonna be a little bit thicker to protect ourselves in our hand. Okay, so the palm is going to be used to detect vibrations. Okay, that's what the palm is going to be used for. And because the layer is so thick, it won't be able to detect like the light touches like the fingertips. Okay, so the fingertips the layer of the skin isn't as thick as the actual palm. Okay, so delicate touches. We're going to caress with our fingertips, and we're going to like slap a bitch with our palm. We're going to vibrate. Her face is going to vibrate against our palm. All right. And, you know, the skin of Bay is going to it's going to lightly caress up and down our bodies. Yeah. That's how you palpate. Okay. All right. Next thing is percussion. All right, that's when you strike a body surface lightly but sharply to make a sound. Okay, usually it's like let's say this is like your abdomen or something. So what you would do is have you would tap your finger against your finger. And depending on like the size, the density, the location of whatever organ that you're trying to like assess, you're going to get a different sound. All right. If there's fluid, you're going to get a different sound. And depending on like I said, the location and the organ itself, it's going to be a different sound. If you do a percussion motion over your lungs, which are, filled with air, it's going to be a resonance. Okay, that's going to be the type of sound, a resonance. All right, based on that location of a lung. If you try to percuss the stomach or the bowel, that's going to be a hyperrenescence, which is just renaissance but louder. Okay. Next thing, if you do a diseased lung, all right, not as much oxygen. Okay, surface area is definitely less. A disease. Have y'all seen it like a diseased lung, like a dried out one? Yuck. If you do that, it's gonna be some sound like a timpani. Okay, timpani it sounds like musical notes. All right. If you do this over the liver, that's going to give you a dull sound, all right? And it's going to be like a medium pitched sound. And then if you do it over the thigh, these thick, well, not my thighs, because I don't got thick thighs, but one day. All right, slim thighs save lives. But anyway, the people too that do have thick thighs, okay, that sound's going to be like flat, okay? It's going to be a soft, high pitch. That tissue is just absorbing that sound. So it's not going to be as a high pitched renaissance. It's not going to be all that. It's going to be a soft, muffled, just a soft, high pitch, flat sound. That's what I say. Okay. Then you're going to have your auscultation. All right. That's where your stethoscopes. I don't know if the winners of the stethoscopes are here, but once again, congratulations to you guys. That one, it was Genesis, Rachel, and Tiffany. Congratulations to you guys that won those stethoscopes. But yes, auscultation, that basically means to listen. So when you have your stethoscope, all right, you have, do I have it right here with me? I do. All right, auscultation, here's your stethoscope, okay? You have your diaphragm, which is the bigger side, your diaphragm. Then the smaller side on the opposite, diaphragm. This is going to be your bell, okay? It's going to be your bell. Bigger side is diaphragm, smaller side is bell. All right? For the bell, that's going to be used when you're listening to low pitch sounds. This is used when you want to hear low pitch sounds, such as like a bruit or a murmur, like a heart murmur. You want to use the bell. Okay. For the diaphragm, the bigger side, you want to use that for high pitched sounds. Okay, such as like wheezes and crackles. Both of those can be heard like in the lungs, depending on if there's like fluid in there, or we have narrowing like airways. We're going to get that wheeze. So that high pitched sound is going to be best heard if we use the diaphragm. Okay, so high pitched for a higher surface area, which is the diaphragm. It's the bigger area. And then the bell, the lower one. Okay. Trying to see how you can remember that. All right. So bell's low pitched and smaller, so it's lower. And then the higher one is the diaphragm for high pitched sounds. So that's how you can remember it. Okay. So that's how you do the inspect, palpation, percussion, and auscultation. Now, very important, that's for a regular physical exam, okay? There's like tons of different types of assessments and like exams. But when it comes to the abdomen and assessing the abdomen, you still have the same 4 techniques, but it's in a different sequence. It's in a different order, all right? It's not inspect, palpation, percussion, auscultation, all right? IPPA is just for regular physical assessments, physical exams. IPPA, I remember it as, what did I say? Damn, what did I say? IPPA. I forgot. I don't remember. It's on my page. It's definitely on my page for IPPA. I do not remember. Like I said, hysterectomy brain. I do not remember what I put. I don't remember. But IPPA is for just regular assessments. But for abdomen assessments, the actual, thank you, I adore Peter Pan. Thank you, future nurse, because she loses it sometimes. It goes away. It goes away sometimes. We're gonna blame the hysterectomy. All right. But yes, so for abdomens, same 4 techniques, different sequence, different order. All right. It's now inspect, auscultate, percuss, and palpation. All right. So for abdomen assessments, it's very important that you auscultate, aka listen, before you palpate. Hear before you feel. Look before you touch. Especially for abdomens. Okay. I asked the question. I didn't get a chance to look at the responses just yet. But if you know the answer, please let me know right here. Why is it so important to auscultate, or however you pronounce it, before palpating the abdomen? Why is it so important? Why is it such a critical, or not say critical, but why is it such an important thing to note, to make sure you follow the different sequence order for abdomens? What is so different, special, unique, whatever? What is so different about the abdomen that requires us not to touch it before looking at it? We have to look before we touch for abdomen specifically. Like, it's singled out. Why? Says, Amanda says sounds will not be accurate. What sounds? Be a little bit more specific. I know what you mean, but I just want to make sure, you say it in full. I don't want, that's an answer to where, like, somebody in nursing school will try to be like, like your teacher would be like, you have to be specific. I don't know what sounds you're talking about. Anal sounds? Was it a burp? Just be specific. Future nurse says to not interrupt the bowel sounds. You want to hear them at natural sound. So yes, the sounds specifically that you don't want to interrupt are the bowel sounds. Okay. If you palpate before listening, you can like stimulate and get your like gut to be active, and so it won't be an accurate assessment. It'll be hyperactive because you were palpating and getting it started. That's like playing with a sleeping baby and then waking it up. Once you wake it up, it's I can't help you, player. So yes, you want to listen before. I'm sorry. Yeah, no. You want to listen. I'm right. You want to listen before you touch or percuss. Listen before you palpate or percuss. You don't want to touch nothing. Listen before you touch. Okay? You want to look before you do anything. All right? Inspection's always going to be first. Okay? Because remember our nursing process. All right? What's the nursing process? What's the first step in the nursing process? Well, tell me all of them. Tell me all of them. But, and by telling me all of them, I'll know which one's first. But in order, what is the nursing process? Great job to everyone that said bowel sounds for that question earlier. Okay. For those that are new or that are just joining, hello, welcome to Camp Nursing School. This is our weekly assembly. All right. We are recapping this past week. The topic was fundamentals in health assessment. And right now we're going through a head-to-toe assessment as well. All right. And very shortly, we're going to be announcing the winners of the NCLEX review book and the IV arm. Okay. All right. Add star. What ad star? I'm mixing up AdPi and S-bar. AdPi. AdPi is the nursing process. That is the acronym for the nursing process. All right, so I'm glad everyone knows to AdPi, but what does it mean? What does the A in AdPi mean? What does the D in AdPi mean? The P, the I, the E? All right. Okay. All right, CRECHAR, assessment, diagnosis, plan, implementation, and evaluation. Danny, assessment, diagnose, planning, implementation, evaluation. I am Abina, got it right as well. Be too short, you gave me AdPi, I need to know what it is. No, but it's not S-bar, it's AdPi. Okay, but yes, it is, but yes, assessment, diagnosis, planning, implementation, and evaluation. All right. So no matter what, before you do anything, you're always going to inspect, assess, observe, look, whatever synonym. Honestly, you have to, in order for you to identify a problem, you have to see it first. And I mean that literally and figuratively. Okay. So yes, that is the AdPi is the nursing process, and then IPPA is the physical exam. All right. Now, as far as the acronym IPPA, when you're talking about the physical exams, there's obviously two P's, palpation and percussion. And you don't want to mix those two. You don't want to be like, oh, IPPA, and then when you got inspect, like, oh, I inspect. A, auscultation, and then when it comes to palpation and percussion, you don't remember which one goes first. Okay, so whenever you're making like mnemonic devices for IPPA, or if it's the abdomen exam, the IAPP, I suggest using words that start with the first two letters. All right, palpation is PA, percussion is PE. So the one that I use is I admire Peter Pan or Peter Parker, one of those. I said Peter Parker. I admire Peter Parker. Y'all know Peter Parker, Spider-Man, okay? But Peter, P-E, I know that Peter is where percussion would be, okay? Because P-E-ter and P-E or cushion, I know that that's what that stands for. And then Parker, P-A, Arker, and palpation, P-A, palpation, that matches. So I know that that's for that. So that's what I use. I admire Peter Parker for the abdomen assessment. And then for the regular physical, the IPPA, I use, damn it, what did I say? Well, damn it, what is it? Ooh, it's gonna piss me off. Hold on. Why can't I just remember it? IPPA. I said international I forgot. Y'all please help me, because I know y'all saw that post. Please tell me what it is. Pretty Girl Wing said, please hold another nursing camp next semester. These things are so useful and are definitely preparing me. Woohoo! No, I'm definitely going to be hosting another one, because this was so fun. And the more I do things, the more I learn. The more you guys tell me what you guys like, don't like, the more I learn, so I can take that and make it even better for you guys. I'm going to have these shirts available for you guys, hopefully tomorrow, or this week at least at the latest. But, you know, this is my job. Like, this isn't my hobby. This isn't, you know, my second job. No, this is my primary, my calling. But yes, I got into nursing because I want to help people. And even though I'm not bedside and I'm not doing honestly anything directly related to any type of patient care. I'm actually helping you guys, nursing students like you guys, get into nursing school, survive nursing school, and then graduate and study for the NCLEX and pass it, become amazing nurses, and then be happy, be merry, and make that cash, make that moolah, make that money. Okay, but still obviously being happy. So that's really what all this is for. So this is literally my full-time business, and let me tell you, it pays very well. Thank y'all so much. Of course. Okay, she gets paid more than your doctors, your CNAs, your surgeons. I'm so sorry, but she's paid. But it's because I really have a mission in helping you guys achieve your goals, get the help that you need, make something that's historically just been overwhelming and just hard to deal with, want to make that a little bit more bearable. We have to deal with this for for LPNs as little as 12 months, and for people that are getting their ADNs 2 years, for BSNs 4 years. That's a long time to be miserable and anxious and overwhelmed. That's a really long time. Who has time for that? Not I, said the cat. I want to enjoy what I'm doing. I want to enjoy what I'm studying, paying all this money for, and these blood, sweat, and tears that I'm spilling for this career. I don't want to hate it as soon 2 weeks after starting my first job. I don't want to do that. And even though not all nursing experiences and it's not nursing as a whole, it's certain aspects of nursing, factors that we can and can't control, but all that plays a part in how people feel about nursing school. And just my goal is to try to make it as pleasant and pleasurable as possible for you, so that you can authentically and genuinely make that decision yourself. If you love nursing, I want you to love nursing. Do go right off into the sunset with nursing. If you go through it and you hate it, then it's okay. You're allowed to pivot. You're allowed to say, I tried and this isn't for me. You're also allowed to say, I tried and this is for me. And even though everybody hates bedside, I personally love it. That's okay. Not everybody wants to be a business owner. Not everybody wants to be bedside. Not everybody wants to be remote. Okay, there's a lane for everybody. Okay? Not everyone has to be in the same lane and want to do the same thing. We can all learn from each other, but in order for that to happen, we also have to acknowledge the struggles of those individual groups and not dismiss them or just, minimize them or whatever the case may be. And that's including you to yourself as well for that negative self-talk. Okay, we went off on a tangent, that's fine. But that is my whole goal in doing these little camp nursing schools, so you can get that confidence and that self-esteem up, so that when you get into these clinical situations, or when you get into a situation where you have to give report or speak with a patient that's being rude or whatever the case may be, you have that, it's like you've been here before. You don't have, it's not like your first time ever being exposed to the information, so you look like a fish out of water and a deer caught in headlights. You don't have that experience. So that's why I want to make sure you guys are being exposed to all the things that I know that you will be exposed to, so that you go in there with at least saying, oh, I've seen this before. I've been here before. This isn't my first rodeo. Whether you get it wrong, right, whatever, you've attempted it, you've seen it before, you've been exposed to it before. So you at least have a little bit, a small sliver or something of an understanding of it, versus, you've been exposed to it right there on the spot, and then like have that pressure to instantly get it or understand, or you're dumb and not meant to be a nurse, so you need to drop out now because you didn't get one portion of the entire chapter. You know, maybe that's not your forte. So all those experiences can really traumatize you and make you really say, like, want to say nursing. But you have to take those incidents and keep them as isolated incidents, and, you know, not let, like I said, other people's actions that you can't control affect you and how you feel about what you worked so hard and paid so much money to complete. So as long as I can help y'all get to a point to where you feel confident and, you know, confident enough to make those decisions not really on your own because y'all grown, but when you feel confident enough to stand in the way that you nurse, not the way that other people want you to nurse or expect you to nurse, society wants you to, you know, be like this particular type nurse. Once you walk in your own path and apply that to nursing, like, that's when the value goes up, the price goes up, and you really start to, like, be that bomb ass bitch ass nurse. Like, you really just become a badass, a badass nurse. That it doesn't matter what your credentials are, because you walk around with that confidence, like, I'm gonna do everything I can to make sure you're okay. And then but that confidence in itself, that comes from, like, experience and, like, repeatedly being in situations to where even, like, you surprise yourself and let yourself get to that point where you're like, I'm here for a reason. I'm in nursing school for a reason. Bam. Like, I got all this. I'm not going to let it, you know, make me anxious. I'm going to go into clinicals and, you know, not want to cry in the med supply closet because the charge nurse is being mean to me or run away from me. Like, my charge nurse in clinicals ran away from me. Like, my group of LPNs, like, they literally ran away because they didn't want to be bothered. We went into the bathroom and cried. Sure. Yeah. But all those experiences led me to doing this, to make sure that, honestly, in simple words like that, y'all don't let nobody play with y'all. Don't let nobody play with your license, and don't let nobody play in y'all face. No matter what their credentials are. Like, we don't put up with the disrespect, professionally, personally, or otherwise. Okay? All right. Let's go ahead. Thank you for saying, because social media has been scaring, giving me second thoughts about being a nurse, but this life has always called me. And that's another thing. And we'll have a talk about that. We'll have a whole discussion where it's just talking about that, because social media, y'all have to remember that social media, for a lot of these people that are, you know, with this evolution of nurse influencers, whatever you want to call it, a lot of people are really posting, saying, and doing anything for likes, because that's how they get paid. So whether it's something rude, funny, informative, whatever, the more out there it is, the more it's going to be clickbait. So, like, a lot of people are talking about, yes, their experiences with nursing, and not a lot of it's positive, especially dealing with the burnout and the mass exodus, because they won't pay us, and, like, the effects of, like, COVID, and seeing, you know, like, all that death and having to work in those conditions, all that, you know, starts to catch up to you and affect your mental. And let me go over what y'all saying. Sorry, 1 second. Let me look. But yeah, all that can start to affect your mental, and you start to see everything that you're consuming. So you have to be careful in the type of content that you consume, especially, like, on Instagram. There are some people that just love to just highlight everything wrong that a nurse does. Like, if it's a nurse doing something bad, it's like, and this person was a nurse, and it's like the worst thing ever. But, you know, if they were like a clown from Party City, would y'all be like this up in arms about it? Like, I'm not sure. But, you know, digesting that content repeatedly, people just talking, just blatant shit, whether you're an LPN or RN. If you're an LP, I don't know the walk of an RN. I don't have that privilege. I have not gone through RN school, not because I'm not worthy, not because of the lack of ability. That just was not the path that I chose. Like, did I have the option? Yes, but where would I be? What was I going to do? It just didn't work for me and my story. So I went with LPN. So, you know, I can only speak from my experience as an LPN, and those experiences, a lot of it's negative because of the constant comparison between LPNs and RNs, and where the majority, if not all, that negative light is it's shined on the LPNs. Okay, tired of people bullying you? Then just go ahead and get your RN. You want to make more money? Just go ahead and get your RN. You want a better house? Get your RN. You want your man to stop cheating on you? Get your RN. Like, it's just like, that's just the answer for everything, no matter if that's the question or not. Like, go get your RN does not help any of those questions. And that's usually the response. So a lot of people a lot of RNs at least won't have the sufficient tools and resources and the guidance to level up within that, you know, within the category of being an LPN, because everyone's just pushing, oh, RN is best, RN is best, RN's the best. And although obviously RN is higher on the nurse hierarchy, obviously they have a different and a broader scope of practice, all this great stuff. Not everyone wants to / are meant to be RNs. Like, you gotta have some LPNs. Like, you gotta have some. If we weren't meant to be here, if LPNs weren't meant to be a thing, it would not be a category. It wouldn't be a thing. Like, it would just be RNs. Nurses and RN would be the basis. But we have that category where LPN / LPN is a category for a reason. So bashing the LPNs and making the students feel like they're dumb pieces of shit for even wasting their time and their money, not yours, Mr. and Miss Opinion, but making them feel like, you know, they're unworthy or unwanted, or they're unworthy of that title of a nurse, just because of, honestly, maybe a story that you heard. It definitely starts with the professors in the classroom, you know, that old school way of thinking that LPNs are just like glorified MAs or CNAs or whatever. You know, that carries over through word of mouth, and it's just been perpetuating throughout the years, and not with me around, period. Like, you're not gonna talk to me crazy in my face, but I don't care what my credentials are. I don't care what your credentials are. Like, I'm not asking you to give me a gold star. I'm not asking you to kiss me on my forehead. Like, address me correctly, period. If someone was messing up y'all name, each and every time they messed up y'all name, y'all would correct them, correct? Y'all would tell them, oh, it's pronounced like this. Thank you. Thank you. Address me correctly. It's the same thing. Same thing. But yeah, instilling that confidence, that's pretty much the whole point. All right. Did y'all watch that fundamentals replay video that I sent y'all? I sent it to y'all twice. Today and again, like, yesterday. But I wanted to make sure that y'all knew that. Okay. And watch that video, because a lot of the fundamental key topics that we were talking about and are gonna be talking about, where it was in that video. All right. So like I said, I'm going to be sending y'all a post quiz. Okay. For fundamentals. Needs to say going for the RN, but still coming for the LPN, period. And if you want, listen, if you want a bridge, I'm here for, I love it for you. If you like it, I love it. Let me help you bridge and pass all your tests, get my Ultimate Nursing School bundle, and sign up for Camp Nursing School. Like, I'm in the business of y'all going back to school. But I just want y'all to be sure about it. I want y'all to be happy. And don't let other people in their ignorance make decisions for you just because it's either like more convenient, you're tired of this, no. We're going to advocate for ourselves, okay? And we're demanding respect and establishing boundaries. Absolutely. All right. The video was sent to, it was in an email. All right, the email with the video, it was, like I said, it was sent twice. I sent you guys before every camp assembly, like literally like maybe minutes right before it starts. I send you guys an email, kind of giving you guys an overview, giving you guys links to things that you probably didn't have before or probably didn't see before, and just reiterating, the newsletter, what's due, what to expect coming up, all that stuff. So that was sent to you guys today. And I believe there was another email that went to you earlier this morning as well. Okay. Her IG page, I actually don't know because it changes all the time. Hold on. Be Too Short. Make sure they're not in your spam or updates or going to like a folder afterwards. If you need to, you guys should whitelist my name or whitelist my email address so that when you get it, it'll go to your inbox and not like a miscellaneous folder so you like are searching for it. Okay. Also make sure you have the app. Okay, the NurseSam app, it's free to download. Free to play these the questions. Okay. There's like Tuesday Jeopardy and NCLEX Jeopardy as well. And that's exclusive to the app, so you can download that. Link is on my website. Link is also in my stories. Wait, no, it's not in my stories. It's also in the link in my bio. All right, available for iOS and Android devices. So make sure you download that and then turn on your post notifications so that if there's any announcements for Camp Nursing School for the rest of this month, you'll get them. All right. We've been restocking some products that y'all been asking me about. All right. We're restocking those, and the people that are going to know about it first is the people on my email list, which obviously if you've registered for Camp Nursing School, then you're on my email list. And if you have the app and have push notifications, you'll learn it there as well before like social media and the rest of the world know about it too. All right. There's only a limited number of each. There's 3 now. Okay. First look. You guys can get a first look because I actually just got them. All right. This is the same one from last time. This is the LPN. Wait. Well, make sure I see. Wait. Sorry. This is the LPN pin. Okay. Does it say it? Proud LPN, and it says LPNs are nurses too, and then lit proud nurse at the bottom. For all my Texas and Cali babies, my LVNs, literally LPNs with the P's of E. All right, instead of P, we got the valley. Instead of the pink, we got the valley. All right, so LVNs are the exact same things as LPNs, but it's called a different thing in Texas and California. I don't know why. But yeah, that's them. But yeah, for my LVNs, I got pretty much the same thing, but for LVNs, all right? Instead of lit proud nurse, it's lit vital nurse. And this is LVNs are nurses too. And then, even though y'all swear I hate RNs, I don't know why, because I never said anything about RNs or hating RNs as a people. I just don't like whoever be trying to play me in other LPNs. Whether you are RN, a DR, I don't care. So if the shoe fits, love. But I also love my RNs, okay? And I even made a pin for you guys as well. Okay, wait, you see it? Do you see it? All right, proud RN. Registered nurse, and then it says, because I earned it. All right? Those are going to be our pins that we have restocked. Our study gummies should be coming soon. Okay? All right. Let's go ahead and finish out this head-to-toe assessment. Like I said, I'm sending you guys more resources on that in addition to a post-quiz. Read through. This is a it's not a Glidden, it is Bella Canva, I believe. It's Bella Canva. Read through your health assessment cheat sheet. All right. This is in your you can take the study gummies while pregnant. It's lion's mane mushroom. So just check with your doctor just to make sure. But depending on where you are in your pregnancy, how far along, just, it's an herb, it's an herbal, it's a lion's mane mushroom. So I just want to make sure that you check with your doctor first, because it is an herbal supplement, dietary herbal supplement. All right, but yeah, you guys go ahead and check out the health assessment nursing school cheat sheet. I'm going to be sending you guys information on documentation. Okay, like kind of how to document, especially how to document the physical assessment. A lot of people, and let me know if this is you, a lot of people have issues like with the verbiage in nursing notes. Is that you? Give me a thumbs up if you struggle with what to type and what to actually say. Yes, this shirt will definitely be for sale, and for everyone that's registered for Camp Nursing School, you guys will get it at an even lower price. So make sure you're getting the emails on the whitelist of your email inbox, and maybe make sure you have the app, okay, the NurseSam app, and put on push notifications so you get notification when this gets on sale, okay? Because there's a limited supply. So I'm going to make sure it does not sell out on y'all. Okay? All right. So, yeah, I'm getting some thumbs up. I'm wearing a small. That's the smallest size, a small. It is unisex fit. And I'm wearing a small. And I love the way it fits. But, yeah, thumbs up for that documentation. So I'll be sending you guys information on that. Tomorrow starts... week 4, which is pharmacology and dosage calculations. A lot of people have been waiting for this week because they've been struggling with pharmacology and dosage, or they're about to start. You definitely need to be here. I will definitely be giving you guys the tips and the tricks of the trade. All right, don't make the same mistakes that I made. I learned from my mistakes. All right, and I compiled them into a list, and I'll be giving you guys that so you can go in there ahead of the curve. Okay, that'll be week 4. We'll be finishing up some physical assessment things in the first couple days of this new week. And you'll be getting your fundamentals post quiz tonight. You scared me. Oh my God. Okay. You scared the shit out of me. Oh my God. But yeah, so I'm going to, what was I saying? Use, do we have to, I saw Jakara in here. Oh yeah, Jakara Lewis Math, love her. If that's what you meant. Do we have to purchase to join? Purchase what? Purchase what? Oh no, you don't have to purchase anything to join Camp Nursing School. Nesla, you saw me jump? Oh my God, like literally I was about to pee my pants. But yeah, you don't have to buy anything to join. It'll probably just be easier for you that you have, the first semester study kit or the Ultimate Nursing School bundle, so that when we talk about and when I refer or reference some of these things, you'll be able to find it in the bundles. Make sure you guys are paying attention to my social media as well, because I'm posting a lot of content there that you guys can go ahead and just save, because I know I save a bunch of educational stuff on my Instagram. So I'm putting a lot of that on my Instagram for you guys to save so you can reference later. Same thing for TikTok. Okay. Fundamentals post quiz, yes. So I'll be giving you guys that post quiz between tonight and tomorrow. It will most likely be tomorrow. But I'll be giving you guys that post quiz for fundamentals, and then you'll also be getting a pre quiz for pharmacology. Okay. Pharmacology is going to be a little bit different than this previous week, just because of the math, and medical math in itself requires a lot of interaction and aka a lot of practice. So you're going to be having like not a lot of homework due, but you're going to be having more assignments than you had before. It's going to be more than 2 assignments. Not a lot of questions per assignment, but just making sure that you get your pharmacology down packed. That is one of the hardest classes due to the massive amount of information that you have to learn and drugs that you have to learn. Okay? All right, so we went through inspect, palpate, percussion, and palpate, oscillate. Okay. Physical exam techniques. For the rest of the head-to-toe assessment, after we take the vital signs and we went through that, make sure you guys check in here for the actual, the lab values where it says what the normal vital signs are. And then, honestly, you really, literally go head to toe. So if you're starting from your head, after you do your vital signs and assess that, you're going to start with your head, which would be your neurological. Your head, your brain. That's going to be your neurological system review. All right. In order to review and assess your neurological system, you want to test reflexes, visual acuity, PERLA. All right. PERLA is PERRLA. Pupils are equally round and reactive to light and accommodation. That's when you do that. All right. And you test PERLA with the pen light. Okay, so whenever you're doing your skills lab or any type of head-to-toe assessment, you have to have certain supplies. Pen lights, one of them, vital sign machines as well, obviously, scale and thing for the height and weight, but definitely the pen light so you can do the PERLA and like a reflex hammer for your reflexes. That's going to test your neurological, make sure that you are neurologically intact. Okay. They're also going to test your cranial nerves. I have a post after we get off live that goes with your cranial nerves to help you guys learn that. Okay? I love a good dirty mnemonic. All right, so moving down from neurological, what's going to be next? It's a toss-up. It can either be, it's your chest area. So what 2 vital things are in your chest? Cardiovascular, your heart, all right, and your lungs. Okay, this is boobs, my bad, and your lungs, which is your respiratory. Okay, so your cardiovascular system and your respiratory system. Cardiovascular, you're going to assess the heart rate and rhythm, which is basically like the pulse, but that's your heart rate. Your heart rate is your pulse. But when you're doing a head-to-toe assessment, like we said, you're getting very specific into the details, okay? They want heart rate and rhythm. So and when you're doing head-to-toe, like I said, you use the apical pulse. So set the scope and you listen to the apical pulse for a full minute, 60 seconds, okay? How does it sound? What is the rate? Is it fast? Is it tacky? Fast is tacky. Is it slow? Brady. Okay, is it normal? Is it within the normal range? All right, normal range for pulse, I think it's 60 to 100. So over 100 would be Tacky, below 60 would be Brady, and normal would be obviously in between. That's the heart rate. What's the rhythm? Is it, well, give me an example of a word for rhythm. Let me see if y'all know. Like for heart rhythm, what would describe a heart rhythm? Okay, what would be an option as far as the health is at the head to toe to describe the heart rhythm? Do you do NCLEX or NCamp? I do NCLEX, well, not NCLEX camp, but this is my first camp, and it's for everybody, RN, LPN. No, the rate would be, it's heart rate / rhythm. So the heart rate is the pulse. That's, how many beats per minute it's going. Bradycardia, once again, that would be the heart rate. Okay? Remember, Brady means slow. So if it's bradycardia, then it's less than 60 beats per minute. And that describes heart rate, not rhythm. I'm looking for rhythm. All right? What would describe heart rhythm? Let me see what y'all answers are. All right, even if you don't know, try what you think it is. If you're going to get it wrong, the best place to get it wrong is with me. So just go ahead. Simply, Brittany, irregular. Exactly. Simple. What's the rhythm? Is it even? It's like a combination of it. You have a normal rhythm. You have a regular. Well, it's not really normal. It's regular. You have a regular rhythm. You have an irregular rhythm. I think you have a regularly irregular rhythm. Yeah, I think that's what it is. Let me make sure. Yeah, that would be rhythm. Absolutely. Let me just make sure. Auscultation, we talked about that. We talked about the sounds, about the hyperresonance and like what it sounds like on different locations. Make sure you review that chart. It's in little Wakanda one. It's like Black Panther. Make sure you review those physical exam techniques. Okay. You will be tested on it, so make sure. Okay. I'm just looking for the, y'all know, normal sinus rhythm. Okay. I'm looking for the specific thing. That's all I'm looking for. And I'm not seeing it to be 1,000. Hold on one second. Oh, wait, here it is. Yes, auscultate areas of the heart. We said that, blah, blah, blah. Note the rhythm, which is regular, irregular. I would say that for that, regular, irregular. You're also checking for, okay, let me see. I start first semester tomorrow. So grateful for you. I bought your Ultimate Nursing Skill Bundle. Yay! Awesome. Good luck to you. All right, so we just learned that the rhythm would be either regular or irregular or a combination like regularly irregular. The next thing you would do for cardiovascular is inspect lower extremities for edema. Edema is another word for swelling. All right. If you have swelling in the lower extremities, This is a critical thinking exercise, a critical thinking problem, okay? Let me see how how well of a critical thinker you are. All right, so if you have, if you're doing the head to toe assessment and you notice that the client has edema, localized edema in the lower extremities, what would be a possible cause? In the nurses, remember the nurses can't diagnose, but what would be something that the nurse probably asked the patient or asked the client to confirm the reason behind it? Fluid retention. Okay. Yes, edema is excess fluid and a buildup of fluid. So by definition, that localized edema is fluid buildup. But what is this is that critical thinking. Think a step further. What is causing that local buildup of fluid in the legs, in the lower extremities? What's specifically causing that fluid backup? What could be? Somebody said CHF. Pretty much. When you see like lower extremities that are swollen, it's usually like a heart failure thing. Whether that's congestive heart failure or just another type of heart failure, not sure, but it's definitely a cardio thing. It's definitely a heart failure thing. Okay, so the fluid is unable, once it goes down there, the fluid's unable to be pushed back up to be dispersed to the rest of the body. Almost same thing, kind of like with blood. But that's where the fluid ends up. Okay, especially because, when you walk around, gravity-wise, it's going to collect down there. So a lot of times, the client's instructed to elevate their legs so the fluid can kind of drain, but it's usually a heart issue, or it's a side effect. This is important because we're about to start pharmacology. This is so important. Let me see if anyone knows this, because you will be asked this. You will see it. I guarantee you will see it within the first month of pharmacology. Okay, so fluid buildup in the lower extremities. Okay, it can be caused by, like we said, heart failure of whatever sort, congestive or otherwise, whatever. If it is due to a medication or a class of medication, no, I mean, I say a class. If it's due, it's this class. If it's due to a medication, what class of medications, or you can give me an example of the medication class, like an example med. What classification of medicine would it most likely come from? All right, Ness, you said blood pressure medication, but that can be a whole slew of things. Okay, so we know. All right, net head, calcium channel blockers, specifically. Calcium channel blockers. What are the main and most common patient complaints after they start calcium channel blockers? Is when the dose is off, fluid collects. It causes lower extremity edema. Okay, so great job, Net. Awesome job. But yes. So yes, it definitely was blood pressure medication or even heart medication, but specifically calcium channel blockers. All right. Just in case you get a question where they're asking you, or they tell you, this is another critical thinking thing. You always have to think steps ahead, be able to evaluate and interpret the question steps ahead. So we just established that the type of medication, the class of medication that can cause lower extremity edema is the calcium channel blocker. Give me an example of a calcium channel blocker. Okay, I want to make sure you're able to identify. If you see a medication, you're able to identify the classification. We'll definitely get more into that next week or this coming week with pharmacology, but that's definitely a skill you need to have. All right, you should be able to see a medication, the generic, and be able to determine, or at least get close to what class that comes from. Because if you know the class of medication or the drug class, the classification of a medicine, then you're more than likely going to know the use and indication. Does that make sense? Okay, so what's an example of a calcium channel blocker? How do we identify medications that are calcium channel blockers? What gives it away? Give me an example. And remember, on the NCLEX, you're only going to have generic. Okay? You're only going to have generic medication names. So if you go into the NCLEX thinking you're going to see the word Benadryl, you're sadly mistaken. You will see diphenhydramine, and if you don't know that diphenhydramine is the generic for Benadryl, you are bleeped. You're bleeped. Okay? All right. Amlodipine. Amlodipine. Okay? An example med of a calcium channel blocker, okay, is amlodipine. That's a good generic. Another one, I like to list 3 whenever I'm studying or asking myself these questions or going through it myself for whatever review, for whatever reason. When it comes to classes, whenever I see a class or come across it, I'm always going to try to identify 3 medications within that class, just in case I see it in that format and in that way. So, there's always going to be that number 1 that's the most popular that you see all the time. But I'm also just, in my mind, I'm going to have at least 2 more tucked away in my back pocket, just in case I need to be able to identify or provide that. Okay, so amlodipine, that is 1. Somebody said diltiazem. Mrs. Jones, to you. I know, that's right. Nifedipine, absolutely beautiful, Kay. I think Norvasc is amlodipine. I think Norvasc is the brand, I believe. I am a beatus in nifedipine. Awesome job. Hydrochlorothiazide is a diuretic. Okay, that's a diuretic. A diuretic would most likely be a contender to be prescribed to the patient, but it depends on the patient's other comorbidities. If he or she has a kidney problem, they will not be on a diuretic. Absolutely not. But yeah, it's great for it's a diuretic, so it gets rid of that excess fluid, which is good because they have lower extremity edema. But a little bit more goes into deciding which type of diuretic, or if a diuretic is appropriate based on the whole medical picture of that client. Okay, but yes, we just went through calcium channel blockers. A tip for whenever, like I said, we'll talk about it more later this week, but a good tip as far as remembering calcium channel blockers, being able to identify them, they usually have, beware about those absolutes, but they usually have the suffix of dipine, like a little line. Let me put it. The suffix is, dipine. Dipine. That's a suffix right there. I just typed it. Right? Depine, absolutely. Like amlo, depine. Nefe, depine. Yeah, those really the two. Those are the popular ones, but that's usually the calcium channel blockers right there. Block that calcium. If you need to go over calcium channel blockers a little bit more, you can find that in the blockbuster themed antihypertensive meds. That's gonna be closer to the actual pharmacology study kit, I believe. Or yeah, no, it's gonna be right after here. Hold on. So really, anything that has blockers is probably most likely going to be in that in this ABC blocker kit. So you're gonna have your alpha 2 receptor blockers, or your ARBs, your beta blockers, calcium channel blockers. That's your ABCs, and then you also have your alpha and your alpha blockers, your alpha adrenergic 2 blockers or something. Yeah, you have those as well. The ARBs is the angiotensin 2 receptor blockers, not the other thing I was talking about. So yes, those are the blockers that can be in this specific study kit, the one that looks like Blockbuster. And the one that we were looking for was a calcium channel blocker. Once again, this is within the first semester bundle, which is also in the Ultimate Nursing School bundle. So if you have either of those, you'll be able to look at this and check this out. Calcium channel blockers. And then this is everything that you need to know about it. All right, so this is basically like a drug card, but on a page. And in Blockbuster thing, you're going to have different types of medication: nifedipine, verapamil, diltiazem, amlodipine, felodipine, nicardipine. All right, remember that dipine suffix I'm telling you all about, you see it here. All right, it's going to give you the specific action of that class. Remember, I told you, make sure you pay attention and learn everything you need to know about the class of medication and the class of drugs rather than the specific individual drugs. Perfect example, calcium channel blockers. This is going to be the action of all calcium channel blockers. So instead of racking your brain and try to remember this whole page times for each one of these medications, which is 1, 2, 3, 4, 5, 6 medications, instead learn about the class, which is calcium channel blockers, and take all that and just list the different types of medication, because everything else is going to be the same. They're in the same class. Okay? It's going to give you your action, like your mechanism of action. Also going to give you your indication of use. Okay? It's going to give you your complications and your nursing considerations and like your patient teaching facts. Okay? That's going to be in there as well. All right? Back to here. We just got finished with, before we get finished with cardiovascular, one more thing that we're going to do to assess our cardiovascular system is to assess the capillary refill time. Okay? Now, adequate refill or perfusion, okay, that's a word that's usually used with capillary refill time, adequate perfusion, cap refill time noted to be, what's normal? How many seconds? Cap refill should be equal to or less than how many seconds for cap refill? Capillary refill, how many seconds? How many seconds? Oh snap, it was a whole page. Someone says 2, someone says 3, another person says 2, another person says 3. 2 or 3? I'm seeing 3s. I'm trying to say what the book says, but this is like, it's like, it's going so hard. Where's the heart? Right here. All right, so here we go. Blood flow. This is literally, it didn't even give it to me. I think it's like, no more than 3. Wait, 5? Which one is it? 2, 3? A lot of, it's like battle of the 2s and 3s. Let me look what Google says. Cap refill time. 2 seconds or less. That's what this says, but I don't know if that's correct. Nope, everything I see says 2 seconds. Yep, 2 seconds or less. No more than 3, but 2 seconds or less. But I highly doubt you're gonna have a question where it's asking you to choose between 2 or 3. Highly doubt. They're gonna test your knowledge way more than that and see if it's real, like it'll be like 17 or something like that, like a real big change, not something like minuscule in that nature. Absolutely not. All right, so that was the end of that was the end of cardiovascular. Now let's move on. Remember, going head to toe. So we did neurological, and this is after we kiwied ourselves and introduced ourselves and everything. Identify the patient, make sure we're working with the right person, respected their privacy, all that stuff. The kiwi, all right? Knock, introduce, wash hands. I forgot what the last I stand for, but like, make sure you're working with the right patient, basically. Then you're gonna check the vital signs, all right? We're gonna do the whole shebang, all right? Blood pressure, pulse, respiratory rate, what did I say? Blood pressure, pulse, respiratory rate, oxygen saturation, temperature, and height and weight. Important, especially if they're a cardio, like on a cardio unit or like a kidney thing, kidney unit, kidney floor. Make sure you get height, but more specifically, more importantly, make sure you get an accurate weight. Which, speaking of weight, when is the most accurate time to assess weight? When is the most accurate time to assess weight? You'll definitely need to know this. In school and out. Especially if you're bedside. Especially if you are bedside. All right. Morning. But when specifically in the morning? After I ate breakfast in the morning? After I took a shower, after I took a poop, should I poop or not poop? To poop or not to poop? That is the question. Whether 'tis noble in the mind to suffer the slings and arrows of outrageous fortune. I forgot the rest. But yeah. All right, so I'm getting different things. Before, when you wake up in the morning, it's definitely morning. Unanimous said it's in the morning, in the AM. All right. Tiana, you said when they wake up. That person may wake up at 2 p.m. You got to be a little bit more specific. Okay. So, in the morning, I'm saying first thing in the morning. Before, are we eating before breakfast? Everyone says before breakfast. So far we are in the morning, before eating a meal. What else y'all saying? Nessa said same time every day, which is very important. All right. If this is an inpatient unit and like, let's say one of the orders is to get daily weight, which you would do if there was some type of like, nutrition goal in the care plan, or like if it's a cardio patient or cardio floor, kidney floor, those usually require daily weights. And, we're establishing the best time to do it as far as, the best time of day to do it. But after you establish that, it's very important to know that the next most accurate thing to do, most appropriate thing to do after you get that initial and that base, is to make sure all your subsequent and your follow-up weights that will follow that initial weight, they have to be at the same time every day. Same circumstances in the morning, before meals. Now I'm seeing before they go void or after they go void. So which one is it? Is it before they void or after? Is their bladder still, are they holding their bladder? Okay, to get this weight? Or are they dropping off the kid? Well, it's not poop, so it's not dropping off the kids to the pool. Or are they just gonna go urinate? Which one is it? Before using the bathroom or after using the bathroom? I'm seeing majority afters. After going. Right, after going. I don't know about y'all, but have y'all ever woken up in the middle, not even in the middle of the night, sometimes it's the middle, sometimes like it's really like 8 o'clock in the morning, whatever. Have y'all ever woke up bladder on full? Okay, it's so full that if you sneeze, like you can literally see a visual of like a really full water balloon, like just bursting. You can see that visual is playing over and over in your head. You have to pee so bad, right? And then it's so full and you have to pee so bad, it's like maybe it was coming to you while you were asleep, but your sleep was so good that like you did not break it at all. Like it was just like, let me just continue sleeping. And then when you finally do wake up to go to the bathroom and you let it out, it hurts so bad. Like it was like you pushed it to the limit. You pushed your bladder to the limit. One more drop. One more drop. It would have been like all up in your peritoneum. Yeah, it would have been real bad. But yeah, you definitely want to avoid. All right, all that urine and pee, all that's gonna add some pounds. It's not gonna give you an accurate weight. It's not. So you want to make sure that you don't carry nothing on from last night. So you don't want to carry additional weight. If you gotta go poop, go poop. But if you definitely need to go, make sure you pee as well and just void and empty your bladder. And then you also want to make sure that you don't bring on anything new to your body. So you don't want to drink anything or eat anything. So before meals, but after going to the potty in the morning. And then after that, same time every day. Great. Make sure, listen, when y'all get tested on that, make sure to be like, ooh, Nurse Sam definitely warned me and taught me, period. All right, so we're getting now into, we're going head to toe. So vital signs, neurology, cardiovascular. What's in the same area as cardiovascular? I got 2 of them. Okay, I keep describing my boobs, and I don't mean to. But the answer is lungs, okay? Lungs, respiratory. That's going to be our next review of systems. Okay, so in order to assess this specific system, we're going to, almost very similar to cardio, we're going to assess the respiratory rate and rhythm, but also the depth. Okay, so respiratory rate, that's going to be your numerical value. All right, normal respiratory rate. What's normal respiratory rate? Tell me right now. Type in the comments. What is normal respiratory rate? Normal respiratory rate. What is it? Go ahead and put it up. See, this is 3 seconds. So over it. Go ahead and let me know. Okay, so I'm saying like 12 to 20, 16 to 20, all that good stuff. Wait, hold on. honestly, it's really going to depend a little bit, but I've 12 to 20, 12 to 20, that's what I learned it as. With that average usually being like 16, 17. That's just from like, that's usually the recorded respiratory rate. Unless you have like a noticeable like respiratory issue going on, like you have a mid-asthma attack or something, more than likely if someone's taking your vitals and you breathing normally, it's going to be like a smooth 16, 17. You usually on average, that's just what I've seen. So I just want to make sure y'all know how to assess respiratory rate because you're going to be tested on it. Make sure you know. Okay. I just wanted to make sure we were on the same page. And we are. Okay. Next thing you want to do, like I said, that was respiratory rate, the numerical value. Next thing is the respiratory rhythm. Okay. So we talked about the cardiac rhythm, like the heart rhythm, the heart rate and heart rhythm. And the heart rhythm was like irregular, irregular. So what would be the respiratory rhythm? What is your answer? How do you describe respiratory rhythm? Rate is the numerical value, so like 12 to 20, 10 to 20, however you want to describe it. But how would you describe the respiratory rhythm? Okay. That's a set question mark. Absolutely. Respiratory rhythm. The lung sounds diminished. Ooh. Ooh-hoo. All right, let's look. All right, so it's respiratory rate, respiratory rhythm, and we also have respiratory depth. Okay? Deep or shallow is going to be how to describe respiratory depth. Are they breathing? Is it shallow breaths? Okay. Is it deep breaths? That's going to describe the depth. All right. The rate, rhythm, depth. Depth is deep or shallow. The rhythm, normal is regular. Diminished. Another person said diminished. That's a good one. I feel like somebody said breaths per minute. That's the rate. Remember, the respiratory rate is going to be numerical value measured in breaths per minute. So just like heart is beats per minute, like 72 beats per minute, respiratory rate would be 16 breaths per minute. So that would still include rate. Okay? This was a question, so that's why I want to make sure y'all know how to describe it. I remember that being a question. Okay? So, what else? Okay. When you're also noting or assessing the respiratory system, you also want to note the effort, the respiratory effort. So are they, let me go back. Sorry, I was looking at what y'all was saying. Rapid. So are they doing pursed lip breathing? Okay. Are they using intercostal muscles or intercostal retractory muscles, or like having difficulty breathing, dyspnea? Are there any adventitious lung sounds? Okay, that's where you're going to move specifically into the actual lung sounds. And that will come from oscillating, remember, listening to the lungs. Okay, remember, for regular assessment, first step is to look, then you're going to feel it, and then you can listen. So oscillating will be the last step that you would do when assessing respiratory. In addition, according to the sequence for the 4 physical exam techniques. Okay, so when you oscillate, you'll be able to listen to the pattern, the breathing pattern. Okay, so what do you hear? Is it a normal breathing pattern? Okay, is it Cheyenne Stokes? Is it are there any crackles? Are there any rails? Are there any wheezes? Like those type of assessments. Okay. Go back to. So that'll be our respiratory. That's after we also take lung sounds. And also, remember, before oscillating, because remember we're following our exam techniques, first thing you do is inspect, so you can observe. You can do this when you're recording respiratory rate, okay, and you're observing it and looking. Observe how their chest rises and falls. Okay, is it symmetrical? Is one side rising higher than the other? Vice versa? Just make sure you note the symmetry of the lungs in the respiratory area. Okay, equal? Are they equal? Are they bilateral? Normal? What you would put is if it's normal, breath sounds clear and equal. Bilaterally, with no signs of respiratory distress. That would be like an example of how you would document that nursing like progress note wise or focused assessment wise. Okay. We I was just telling y'all about those lung sounds actually. Those lung sounds, like I said, rails, wheezes, crackles. If you have to be able to know what they sound like, what those words sound like. So like audio, listening to you, like you won't just be able to read and understand what an audio, like what a lung sound sounds like without listening to the sound. Does that make sense? So Google lung sounds. Pull up a YouTube video, something like that. Pull up a TikTok. I'm pretty sure that I know there's a TikTok about it. I've seen one myself. Pull up a TikTok or pull up a video that's giving you examples, like visual and audio examples of what specific lung sounds sound like. And be sure to note, critical thinking, take it a step further, be sure to note what would cause those specific lung sounds. Like what would cause crackles? Tell me now. Comments. Is it a popular one? Sorry. Is the popular one that you should definitely know? Crackles. If you hear crackles in the lungs, you know that, like, what can you expect? What do you know about that assessment? Crackles in the lungs. If you auscultate crackles in the lung, what do you know? What can you infer? Someone said pneumonia, someone said COPD. Not quite. Crackles. Okay. When I say crackles, they're also called rails. They're previously called rails as well. All right. First of all, there's different characteristics of crackles. I'm going to read this to you. All right. You have fine crackles and medium crackles. So think like snap, crackle, pop. Snap, crackle, pop. That's who we are. Snap, crackle, pop. Look at that. Fine and medium. Okay. So fine crackle would be like a high-pitched crackle and pop noise. Okay. It's usually heard through the end of inspiration. Inspiration is when you breathe in. So, and then towards the last couple seconds, you'll hear a high-pitched sound. All right. Medium crackle, you also have, of course, medium crackles would be medium-pitched. Easy. That one's not cleared by cough. The first one's also not cleared by cough. And then coarse crackles, those are low-pitched. And it's more like a bubbling or gurgling noise. Let that kind of help you. Bubbling or gurgling sound. And that starts during early inspiration or breathing in and into the first part of expiration or breathing out, exhaling. So you'll hear a gurgling noise all the way from right there, and then it's going to be normal. Like you hear it like 60% of the way, like a gurgling. So where else would you see, or what other situation would you hear or see someone gurgling? Okay. Oh, someone's LaDon said it. Fluid overload. Lipsticks and Scrubs said it. Fluid. Cardio Barbie, CHF. All right. Bronchitis, COPD, pneumonia. That's more of a restrictive airway issue. Crackles is from fluid. Okay, so just honestly think about somebody drowning. Crackles is like basically like they have fluid in their lungs and they're like drowning on dry land, basically. So, actually depending on the type of pneumonia, because pneumonia is usually diagnosed because there's fluid in the lungs, and those are usually fine crackles. So pneumonia, especially if it's aspiration pneumonia, pneumonia, it can be heard, that can be a cause of fine crackles. Okay. Oh shit. Hold on. No, that's right. So those are fine crackles. Okay. Fine crackles can also be, may be heard with, heart failure, asthma, and restrictive pulmonary disease. Medium crackles are the same as the ones in fine, just worse. And then coarse crackles, those are usually noted in terminally ill clients with a diminished gag reflex, or people with pulmonary edema. Pulmonary edema. So edema, swelling, excess fluid, pulmonary, excess fluid in the lungs. That's pulmonary edema. So that's you're definitely going to hear some crackles. So snap, crackles, and pops. And somebody with pulmonary edema, somebody with like aspiration pneumonia. Bronchitis is where you would get rhonchi. So ronk, let that kind of help you. Rhonchi, or bronchitis. Asthma is going to be exclusively for wheeze. Remember, my little cheat sheet for asthma, and it was after like Lil Wheezy. Get it? Wheeze, Lil Wheezy. Yeah, takes your breath away, literally. Okay, but yeah, asthma is wheeze. Bronchitis is rhonchi. And then another one would be pleural friction rub, and that's caused specifically by pleurisy. So the names help you. Okay. So those are lung sounds. Next thing, gastrointestinal. Remember, we're going head to toe. We just did our lungs and our cardio. Now we're kind of like in abdomen. So that would be gastrointestinal. All right. What you want to ask the patient, when was your last bowel movement? Okay. That GI includes, literally your digestive tract. So it's your stomach, your intestines, all the way down to like your rectum. Okay. Yeah, so here down. So when was your last BM? What was the color of it or characteristics? Was it smellier than usual? Okay, head to toe assessments is a professional way of being nosy as fuck. Okay, if you ever just wanted to just be nosy, you'll love head to toe assessments. Ask them all day business. Okay, when was your last bowel movement and what color was it? Was it like a yellow, a green? What about firm? I don't know if you touched it. Was it like a soft? Was it like soft serve ice cream? Was it like hand scooped? Was it a little bit more firm? Was it yeah. So those are the type of things that you're gonna ask. So last BM, the color of it, the form, okay? So you can assess whether or not you have like constipation, will be like little pebbles, or diarrhea, just be like, depending on severe. You have that diarrhea where it's like nothing forms and it's like oatmeal, like really loose oatmeal or grits. And then you have like that severe diarrhea with like, it's pure liquid, like it's literally throwing up out your booty hole. Like that's how bad that diarrhea is. So you guys assess it. Soft serve got me. But yeah, what's your diet? Okay, is there a lot of roughage, aka fiber, in your diet to help form your stools? Okay, your diet's obviously going to affect your stool and your BM habits. Next thing you want to do, remember our techniques. Okay, remember our techniques. Look before you touch, before you listen. Look, touch, listen. All right, so inspect with your eyes. Observe. What do you see? Is anything extended? Do you see any bulging? Look at the color. Are there any marks? Are there any surgical scars? Anything like that? Look at the contour of the abdomen. Okay, do you see like a pulsating mass or something like that? Look. Next thing, after you look, you want to touch it. But which one? Are you going to percuss it or palpate it? Which one's going to be first? So it's IPPA, but once again, we don't know which P comes first. So what was my mnemonic? It was I admire. No, that's the other one. Is Peter Pan angry? Sure, whatever. So but it's in reverse. Is Pan Peter? So it'll be PA. So you'll palpate first and then percuss. I am Peter Parker. But I am Peter Parker. Remember, oh shit, y'all right. This is abdomen, so it's IAPP. Oh, look at y'all teeth. Ooh. So it is I am Peter Parker, because remember, this is abdomen. If it was any other system, it would be IPPA. Okay, but it's abdomen, so it's I am Peter Parker. All right. So inspect, and the next thing you do is auscultate. Okay, you auscultate before you touch in the abdomen. All right. And yes, that is because when you touch it, it will disturb the bowel sounds and give you it will not give you an accurate reading. Okay, so auscultate the bowel sounds in all four quadrants. Listen to it. Are they normal? Are they hypoactive? Are they hyperactive? And then you want to palpate the abdomen. Okay, when you're palpating, remember you're assessing, you're touching to assess characteristics. Is there anything that's bulging? Is there distension? Is there tenderness? Is some areas hurt more than others? Are there any abnormal masses that you feel that should not be there? Feel around, see how that feels. After GI, you're gonna go down to GU, which is your urinary system and your genitals. All right. Remember, inspect. Always look at something. We're gonna look at that urine color observe the amount. Yeah, observe the amount. Observe the color, the amount, the smell, the odor, if there is one. And then you want to palpate your bladder, see if it's distended. Okay. Is the patient continent or incontinent? Do they use the toilet? Do they use the potty? Or do they go potty in their pants? Like, do they have pull-ups or whatever the case may be? That's incontinent. Okay. Continent is potty trained, sure. Able to go to the bathroom independently. And incontinent is unable to go independently, and they usually soil themselves. Okay, that's important, because if you have a patient that's incontinent, unable to go to the bathroom by themselves, they're usually, because they soil themselves, they're always going to be, or they have a higher chance, and they're more than likely going to always be sitting in a wet environment. And what does that do to your skin? Constant moisture, excess moisture to skin causes what? Excess moisture, exposure to excess moisture to your skin causes what? Why is that concerning? It can cause skin breakdown. NCLEX, pressure ulcers, is a medical diagnosis. That's a medical term. We can't use that, because especially if the doctor has not, or not the doctor, but if the provider has not diagnosed them with that or anything else, it's not within our scope of practice to use words like pressure ulcer. That's a medical term. What you can say, and what my girl, Pretty Girl Winks, came in and said, which is correct, skin breakdown. That's the nursing diagnosis way of saying it. Okay? Remember, nursing diagnosis, you have to do everything within your scope of practice. Nurses do not do anything medical-wise. Okay? We have a nursing scope of practice. We don't have medical training, if that makes sense. We can't diagnose. So skin breakdown would be what we say as nurses. Okay, it's an increased chance of if we had skin that had a high chance of breaking down, what would be the next concern? For skin that's being broken down, what would be our next concern? Skin that is breaking down, what would be our next concern? Infection. Thank you, Stephanie. All right, that's how you stair step it. All right, so from something as simple as, is the patient continent or incontinent? You've already taken that and possibly foreseen a possible infection. You see what I'm saying? That's an example of critical thinking. That's how they want you to think. Okay? Take something small and don't just take it for face value. Don't just take it as what it is. Think about the possible implications that will have further down the line, and what that can mean for your patient. That's how you got to move. That's how you got to act. Does that make sense? Thumbs up if that makes sense. All right. So like I said, all that from asking whether or not they're continent or incontinent. Okay. Next, if they are incontinent, do they have a Foley catheter? Is it an indwelling Foley catheter, or is it one that is intermittent? Indwelling Foley catheter or intermittent? Make sure you know these words. All right. Indwelling is just always going to dwell there. It's going to dwell inside. Indwelling catheters are catheters that dwell inside. Okay, all the time. It's not taken out. It sits there. It's taken out per doctor's order, and every so often, depending on the facility. So that's the Foley catheter. Next thing, a condom catheter. Oh, intermittent. Intermittent means once in a while. All right, it means like intermittent is a perfect example of is regularly irregular. So it's not constant because it's not all the time. It's intermittent, it comes and goes. All right, so a condom catheter is, honestly, let the words help you. It's literally a condom and attached to the end. You know where it's like a little hat, like right here, that little tip part? That is like attached to a tube, like a catheter tube. That's where that's going to be attached to. So it's like you put the guys put on a condom, and obviously female patients cannot get condom catheters. Yes, I've had to explain this before to someone in real life, but yeah. Females don't got penises, so we can't do nothing with condom caps. What we're going to do is stretch it out and like pee in it like that. Like what? Anyway. But yeah, condom casts. And those are so annoying because if they little junk, they little meats be shrinking. It just be like a little turtle head. It just be like this. You know how annoying it is trying to put a condom on like this much penis? Do you know how annoying that is? It's very annoying. Because then you gotta peel the foreskin back and try to like stick it out a little. Try to stick it out a little bit more than usual so it can catch on, so you can go ahead and no. Anyway, sorry, we're getting off track. My bad. So yeah, condom cast for guys. Jesus, I'm like, oh, please just order a Foley, please. Nobody want to play with this man's little Peter Packer, please. Anyway, next, is there any vaginal discharge or like penile discharge? Okay. Is there a discharge coming? If there is a discharge, what color is it? Is there an odor? That should be it as far as like inspecting the characteristics. There should not be a smell portion. I mean, not smell. It should not be a taste portion. You should not know how the penile or vaginal discharge tastes. You should not know that. Okay? Next thing you know for genital urinary. Remember, it's genitals and urinary. All right? Next thing you know that you need to know. Okay, so what I have written here is last menstrual period for women of childbearing age. But with the new laws and, Roe versus Wade being overturned, I'm not sure if it's safe for women to disclose that. I'm not sure. But it's also needed in, like, for example, determining like Nigel's rule, just in case you're pregnant, that the first day of your last menstrual period it's important. It's a vital part of the equation. So I don't know how that's gonna work. I do not know how that's gonna work. And they're super sticky, right? They are. Ew. Okay, so genital urinary, we're here. Remember, we're going head to toe. So now we're moving down. We're past the genitals. What's past the genitals? Let's go with musculoskeletal, okay? We're going to assess ROM, which stands for range of motion, okay? There's two types of range of motion. Do y'all know? There's two types of range of motion. What is it? What are the two types of range in motion? Okay? You have to assess both types of range of motion and muscle strength. Okay? You know how you do that? That's where you like have them like, you be like, all right, I'm gonna put my hands up. I'm gonna push against yours. Don't let me, don't let me move. Or, vice versa. And that's gonna test their muscle strength, their muscle tone. That type of test. Okay? All right, thanks. Two types of range of motion, active and passive. Thank you so much. So active range of motion is going to require like active manipulation. passive range of motion is more of a passive. It does not require that manipulation. It's going to passively almost move. Passively move, sure. Also, with musculoskeletal, note, are there any issues with mobility or gait? Okay. Gait is another word for, like gait as in G-A-I-T, is another word for like walking. So we're going to observe if there's any issues with that. Is there limp? Is it equal? Is it smooth? Are they tripping over their feet? Are they using any, what's the term? Assistive devices. All right, that goes with gait and musculoskeletal. Are they using any devices to help them walk or to help them move? Those devices can that can be a wheelchair. All right, that can be and that's manual wheelchair versus a motorized wheelchair. That can be crutches. Okay, and how many crutches? It can be a walker. What else? And a cane. Thank you, Ash Cash. And it can also be a cane. All right. If you watch the fundamentals tutoring review that I sent you guys yesterday, or was it this morning? I can't remember. For you guys to watch as another assignment. It talks about specifically within gait, like if the client does have an assistive device, there's specific ways, there's correct ways for that client to use it. Like there's a specific way to teach them how to use crutches. And because patient education and teaching is so big within nursing, a lot of our questions on our nursing school exams and NCLEX, in addition to making sure, once again, that we know the content and know the material and the implications and everything else, with that, we're also going to be tested on, like I said, patient interaction, how we're able to speak to our patients. Can we speak to them therapeutically? That's more mental health. Can we take a procedure and then give it to them in layman's terms to where that they understand it? You'll be tested on that as well. Okay. So that's musculoskeletal, right? And then obviously, once again, when you assess each section, you want to make sure that you're assessing pain as well. Okay, even though you assess pain kind of generally, remember pain can be generalized and kind of like all over, which is more like malaise or like a general unwell feeling. Or it can be like local and specific. Like I just broke my right pinky toe specifically. So nothing else hurt but my right pinky toe. So, as far as my pain assessment, if you ask me if I have pain on my arm, my answer is going to be no. But if you ask me if I have pain, and when it comes to musculoskeletal, especially down to our extremities, you ask me about my right pinky toe, I'm going to say 10 out of 10. And I'm going to say 10 out of 10. And the only thing I wish for my pain is that thing that starts with a D. Let me stop saying that. All right, so that was musculoskeletal. Next thing, we've pretty much gone head to toe, but now we're going to go out, if that makes sense. Now we're going to talk about the skin. Now we're going to talk about the coverings, okay? Integumentary, which is another word for skin, okay? Once again, inspect. You want to inspect/observe everything first before you touch it, before you listen to it, except if it's your abdomen. But this is skin, so it's going to be the regular IPPA. Okay, inspect first though. So you want to look at skin color, all right, and not not in a way where it's like, oh, you want to look to see what color they are to determine what race they are, to determine the kind of treatment they're going to get. No, that's not what you're looking for. Hold on. Okay, sorry. But yeah, that's not what you're looking for. You're looking at their skin color. Sorry. You're looking at the skin color to make sure it's appropriate and that it matches their what they identify as, their race. So if someone you know, claims that they are Caucasian, but you're looking at their skin color and they look yellow, that don't match. That don't match. That don't match. You didn't check that you were race Big Bird. Like, why are you yellow, ma'am? Now, if someone is yellow, if you observe someone's mucous membranes or skin and you determine it's yellow, what is that called? What is that? What's the term for that called? Yellowing of mucous membranes and skin. What is that called? And what does that indicate? Stair-step it, critical thinking, take something. What could they possibly, what could it possibly be? And how could it impact my patient? Can it harm my patient? If so, how? All right, so yellowing of the skin is jaundice. If someone's jaundice, what would be the next concern? Jaundice occurs from what? Thank you, Stephanie. Liver failure. Someone earlier, I am Abina, you said organ failure. It's a specific organ. It is specifically the liver, all right? Because if they had kidney on there, I don't want you circling kidney. Jaundice is due to liver failure, okay? All right. So yeah, that's inspecting the skin color. And there's different things that can be, so yellowing of the skin is jaundice. A bluish discoloration or a bluish tint to the skin is called what? Comment right here. Bluish tint to the skin is called what? And it's usually caused by what? All right, these are the characteristics. Cyanosis. All right, bluish discoloration of skin is cyanosis. What usually causes cyanosis? What usually causes cyanosis? Lack of oxygen. Absolutely. If you have a lack of oxygen for an extended amount of time, what usually occurs? Lack of life. Absolutely. All right. Insufficient oxygen. You need oxygen. Our airway, breathing, circulation. All right. You literally need that to live. And so if you see someone, or if you're inspecting skin color and you see blue, priority wise, if you have a blue colored patient and a yellow colored patient, which one takes priority? Blue or yellow, blue or yellow, blue or yellow, blue or yellow. Which one takes priority? If you have a patient, if two patients, and you're looking at you're inspecting their skin color. One's blue, one's yellow. Which one would require immediate and priority intention and intervention? Blue. Absolutely. Because that means that this person more than likely, they're not getting any air in. They can't breathe. All right, let them wait long enough. They're not going to be here much longer. All right, they're then going to go pale. Okay, which means lack of blood flow, which is another sign of lack of life. Okay, so that's definitely going to take precedence because yellow mellow over here, that while important, That's you don't take precedence over my daughter can't breathe. Okay. Are you in any pain? Are you okay? If you're stable, when you just like look like a minion, all right. Well, here's the remote. Here's the call light. Thanks so much. I gotta go. So yes, cyanosis blue will come first. Great. Erythema is red, and that usually occurs where there's like a flush, where there's like a flush of red blood cells or a flush of blood. It's also, if depending on the stage, it can also indicate trauma, like hit to an area if it's red, or like a burn, a scratch, inflammation, basically. Hyperthermia. All right, that's a good one, Shonda. Hyperthermia, higher temperature, it's gonna make you flush. Okay, that's a good one. All right, so those are characteristics of skin color coming, which as a result of you inspecting the skin of the integumentary system during the head to toe. Okay, next thing to do, after you inspect skin, you want to inspect skin turgor. Okay, skin turgor. What is y'all know what skin turgor means? Tell me. What is skin turgor and how do you assess for it? All right, well, skin turgor is an indication of what? And how do you assess for it? Let me say that. Okay, Shonda. Skin turgor is a sign of fluid loss, aka dehydration. All right, so you are assessing the client for dehydration or signs of dehydration if you are checking or assessing their skin turgor. All right, the elasticity of the skin. All right, so a great way to test that is the back of the hand test. Okay, usually if you go like this, and it depends on the age of the client. If you have a question that's telling you how to assess for dehydration in a pediatric or infant client, there's a more appropriate and a more accurate way to assess for that than how you would assess for it in adults or older adults or people older. Okay, just based off of how the body works and whether or not they're like fresh in this world or fresh on the way out. I don't know. But yeah, skin turgor, a good way to do this. All right, if you tent, that's kind of a key word there. If you tent the skin by kind of pinching it up, let me see if y'all see that. Tent the skin kind of like that, pinch it up. If you're dehydrated, that means the elasticity in your skin is gone. All right, you lack elasticity in your skin because you lack moisture. All right, you're dehydrated. Okay, so if something lacks elasticity, it's gonna lack stretch. Okay, so if I had very elastic skin from being moisturized, me doing this, when I let go, it'll completely go back to normal. It'll like almost like snap back. All right, moisture equals snap back. If I'm dry, it's gonna continue to tent. All right, it's not gonna be elastic. It's not gonna go back down to its original factory settings. All right, it's gonna stay tented because it's lost the elasticity in the skin. Does that make sense? All right, so yes, that's moisture, that's turgor, also temperature. All right, we talked about this earlier as far as physical exam technique. Which side of the hand is used to assess temperature? The palm or the back of the hand? Palm or the back of the hand? Which side of the hand assesses temperature? Palm or the back of the hand? Tanisha said back. Be Too Short says back. Roni says back. Shauna says back. Back to back. I'm getting back to backs. But yes, back of the hand, the dorsa side of the hand. All right, and that's on this side of your study kit, right where it says here. All right, the back dorsa of hand is for temp checks. Okay. The palm is for vibrations. All right. I was like, where'd I go? Let me go back to it. All right. So, what else with the skin? Like I said, notice any cuts, any abrasions, and these are all different. This is kind of get into wound care, but all these different names, they mean things, and they're all different things. So, inspect for like cuts, abrasions, burns, what's another word? Rash, different types of things like that. Papule, stuff like that. Assess to see if they have any wounds like that, whether that's like a surgical wound or like a wound from trauma. If it's something like a surgical wound, then like, for example, if they have like a chemo port, that's a surgical wound, you would document that. Okay. If they have like a dialysis port, you would document that. Absolutely. What's another type of surgical wound? If you have like a peg tube, like a feeding tube, something like that, you would definitely document that as under integumentary. You would notice, like, first of all, it's a wound, which means, okay, let me say this. First of all, you identify that it's a wound. Second of all, you're going to identify the type of wound, okay? It's a wound that breaks the skin. It's a wound, and so remember, if the skin is broken, that means the skin integrity is compromised. And if skin integrity is compromised, there's a risk for infection. All right? Always remember that. So, because there's always a risk for infection, whenever you're inspecting skin and see wounds, surgical or from traumatic, after you identify that they exist, note the characteristics of the wound, all right? To see if there's any signs and symptoms that infection is there or coming, okay? Give me some examples of signs and symptoms of an infection. There's like 4. It's the same 4. Give me some examples of signs and symptoms of an infection. Fever. Absolutely. Fever. Fever or warmth. Fever, yeah. I'm about to say this. You may have a bunch of synonyms that mean the same thing. Fever, warmth, hyperthermia, okay? Excess heat, all right? Those words basically mean fever. Okay, it's signs and symptoms of infection. Another thing, or inflammation, whatever. Another thing is redness. Okay. Did anybody say? Okay, I see odor. Remember, we're looking for infection. What about swelling? It's gonna be redness, warmth, swelling. Okay. Depending on where it is, it's going to be a strong odor. Okay, that's usually how you can, and if there's drainage, note the color of the drainage. All right, or the discharge. Infection from a wound, usually, the drainage or discharge is usually what color? All right, well, y'all tell me that. I'll move on to the next thing for integumentary. Next, remember, surgical wound. An IV is a surgical wound. Remember, wound, especially if it's a break in the skin, for whatever reason, an IV goes into your vein. So we have to break through the skin, which means it poses a risk for infection. Yellowish green as far as like infection. Yes. That's what we call, this very important to know. So when you do have an infection from a wound, or just an infection in general, and you know that the drainage is yellow or green, how would you record that? What's another word for infected drainage? How would you record that? If you were typing your note, what would you say that you noted? Like blank. Well, first you always note what you see. So first of all, the drainage. Do you see a lot of drainage or a little bit? Quantify it. So you would type, if it's a little bit, you would say scant. Okay. Scant amount of blank, blank, blank noted from IV wound, IV site on left hand. Just example. All right. So let me see if anyone said it. Did anyone say it? No, no. We're not looking, I don't want y'all to describe the quantity. I want you to give me another word for the fact that it's infected. Sometimes I'm going to need help with that part. Okay, because you may see it, and I want y'all to know what it is if you see it. Okay, let me put it like this. Almost natural by nature billionaire. Almost. All right. So I don't know if y'all can get that anyway. Okay. If we have drainage and it's usually yellow or green, we usually call it pus. Correct? Right. So if we are describing drainage that resembles pus, or that is pus-like, thank you, Char. We can't say that the drainage is pussy, because when we type that, we may mean to put that the drainage is pussy, but to the doctor, provider, whoever else reading it, pussy looks a lot like pussy. And I just don't want you to get like deposed or anything like that, or just have like your note read out loud and it's just like the patient's drainage, the patient's pussy drainage was moderate in amount and smell, but like you don't want to say that. You don't. It's embarrassing. Didn't happen to me. I'm just kidding. But yeah, the proper way to term or to call drainage that is infected is purulent. Okay? Purulent drainage. You don't want to say pussy because it's not a word. It's not a word, and it don't read like it sounds. Okay? It do not read like it sounds. I'm trying to save you. Okay? From having to say the word pussy to a 94-year-old. I'm trying to save you. All right? So, that was integumentary. So we did head to toe. We did neurological, cardiovascular, respiratory, gastrointestinal, genitourinary, musculoskeletal, integumentary, and now, just like kind of at the beginning, we did kind of like our introduction, our Kiwi. We introduced ourselves and introduced what we're going to do and confirm the patient. After we perform, we just performed the assessment. Okay? We just performed the assessment. We just asked, that was just an overview of what we ask and how we do it. Now we're going to let them know that A, it's finished. and set them up to be as safe as possible in the room before you leave. Okay, so the next category, I guess you can call, is safety. All right, once again, we're right here. The next category is safety. Okay, so there's going to be things that you do every time you're about to leave a patient, leave a patient's room or leave them alone, whatever. It's what you do, and then you document this as well to CYA, aka cover your ass. Okay, so to ensure safety, remember, client safety is like the literal theme of the NCLEX. Like, I'm not joking, that's the theme, client safety. So in true safe theme manner, all right, before you leave the patient's room, to make sure they're as safe as possible, you want to do a few things. One, make sure that the call bell, call light, whatever you call it, is on, plugged in, and within reach. Okay, I know sometimes they're annoying and you and your CNA just want to take it out of the wall, but you got to make sure it's plugged in before you leave. Because just in case they really need you, it's going to be off and silent. So make sure it's plugged in, working